Well, good morning. Sorry for, I guess, a little technical difficulties on our part. Um, so let me introduce myself first. I'm a faculty. My name is Zoran Jelcik. I'm a faculty here at this school for last 11 years. So they're putting up with me for 11 years. My background in Chinese medicine is from this school. Graduated 2004. I hold a, I think at that time was called Diploma Doctor of TCM or Advanced Diploma. I also hold a 5-year degree in Chinese medicine, Bachelor of Medicine from Henan University of Traditional Chinese Medicine. I teach in some other schools in GTA occasionally, but this is primary where I'm located as a faculty. My previous background is in Western medicine. I'm a former cardiothoracic surgeon, former massage therapist, former osteopath. So my practice is currently just in traditional Chinese medicine. I'm involved a bit with our regulatory college. I'm currently expert witness for the province of Ontario with the OCTCM PAO, College of Traditional Chinese Medicine. I teach here pretty much whole curriculum. So today I will be reviewing and covering traumatology, pain management, and seems like from here RSI a bit, I guess. Repetitive strain injuries, sprains, strains. So these 5 books are compiled by Professor Wu, the president of the school. Idea was that if you remember when you originally did that initial forms to get grandparented, there were 52 conditions, and they asked you which of these did you saw in your practice, how often. I don't know if you remember. That was okay. So the after some digging, it was decided that most likely you, as a grandparented member of CTCM PAO, will be examined out of these 52 conditions. So difficulty was to narrow it down to what exact conditions, because there's so many. Of course, medicine is ever-changing field. Every year you have more and more conditions and diseases. So this is the part that you don't have in your books that I just want to briefly review. Come on in, please. And it really cuts to the bottom, or like a core to the process of how to sort of diagnose, right, in Chinese medicine, which is a combination of some elements of biomedicine, Western medicine, and CCM, classical Chinese medicine, that eventually in 1946 got called traditional Chinese medicine. So Chinese call the process Zhen Duan, split it into 2 parts. So Zhen is basically diagnostic procedures or gross compilation of the signs and symptoms through 4 methods. Even technically there's 5, but okay. So there's inspection, smelling, and listening, inquiry, and palpation. So using your sensory outputs to question, palpate, sort of size up your client, patient, get a sense of where they are, and siphon the data till you can actually do what we call Bing, or disease differentiation, right? And then after you do this, then the second process of siphoning off, or Duan, so disease identification follows, and then particular flavor of disease, pattern, or syndrome is decided. And your treatment actually then follows based on pattern. So it acknowledges the disease, and I particularly picked a headache, because in Western medicine, headache is not a disease. It's a sign or symptom, right? Either reported by the patient or observed by you, clinician. But in Chinese medicine, it's a disease because it's showing up in so many different pathologies that basically earn the designation of its own. So the disease could be something like flu, upper respiratory disorder, which is more aligned with biomedicine. And lots of people then say, okay, I can see disease in that, but I don't see disease in headache, right? And then, of course, based on what kind of headache you have, and I put a few of them there, you would decide that this patient has, I guess, let's say acute presentation of headache, and particularly he or she has wind-cold headache. And therefore, your treatment principles would be based on acknowledging the disease, the headache, so that's bing bing, acknowledging the syndrome, jeng bing, so wind cold, and then treatment principle according to that would flow something like, is everything? So, okay, sure. Are you comfortable? Okay. Please, why don't you use this chair? Okay. So, and then treatment principle flow against to that. So, remove the wind, dissipate the cold, reduce the pain, and normalize the blood and chi flow into the head. So basically, you would acknowledge the disease, you would acknowledge the syndrome, and you would acknowledge the therapeutic action that you would take to remove the pathogenic influence of these elements, disease and the syndrome. So this is really a core thinking that TCM clinicians and acupuncturists are using when they're narrowing down everything. And the college expects you to demonstrate this, right? So today we're going to do this by reviewing these 10 diseases that we have that Professor Wu compiled here. And a list is actually taken from those 52 diseases that originally was put forth to us by CTCM PAL. Do you guys have any question about this? Is this something you saw before and dealt with it? Yes? Okay. And if you didn't, this is really a core of TCM. So I would suggest you get familiar with this, because not only for provincial exam, in your case, grandparenting transition, but also for your own practice, because this is how we communicate in TCM community and acupuncture between each other, right? Now, in real life, no one's going to have just one syndrome. No one's going to have just one condition. So we will have maybe primary condition, secondary condition, primary syndrome, secondary syndrome. So the treatment would be a bit more complex, obviously. And from visit to visit, these things will change, especially the syndrome or pattern part. Disease would not change much, right? Till we reach some kind of equilibrium, homeostatic balance, yin and yang balance, whatever would you want to call, right? So, and that's within the philosophy of TCM, where we adapt the medicine to patient, not the patient to the medicine, as our biomedical colleagues. So let's have a look at the first condition, which is the headache. Tou tong. So tong means pain, right, in Chinese medicine. Just press. Oh, okay. Yes, of course. Sorry. And feel free to, if you want to take a snapshot picture, if you want to copy, whatever it's easier for you. I'll just leave this on the side. So the headache, let me just dump this here. Headache is one of those clinical conditions that we encounter a lot in our practice. It's a usually standalone condition, but I would say more than 50% of the time, it's a secondary condition matched with something else. So for example, person can come in acute presentation of the flu with the headache. You can have hypertensive patient comes with the headache. You can have neurological condition. That secondary element is a headache, right? So in this case, we're going to examine the headache as standalone. Of course, this can be added to any other primary or secondary conditions later. So in the book, what Professor Wu tried to do is executive sort of summary in the beginning, where he sort of separated all the main syndromes, added major points that you would use, and then add you 1 or 2 points that you would add according to the syndrome or pattern presentation. So for example, if you encounter the headache, the basic TCM or acupuncture formula of the points would be these few points here, and we're going to describe them soon why. And these would be used for what do we have? About, is it 8 different syndromes for the headache? Okay, so 5. Is it 8? Okay. So, and then you would just add additional one or two. Now, this is a very basic acupuncture formula. So, for purpose of examination, obviously, you'll be able to bring your own books, something that the regular TCM students cannot do. So the college recognizes that you're already practicing acupuncturists or TCM practitioners, and this is more like a summary that you can bring in. On a real board exam, all you need to bring is your memory, right, and your skills. So you'll be able to review it. So that's why the summarized version. So idea is that you should add about 5 to 8 points there next to condition that you asked, and it'll be in the form of a scenario. I don't know, 58-year-old female, comes with elevated blood pressure, red tongue, no coding, rapid pulse, wiring in nature. Mm-hmm. You don't have to, because you don't know what they're going to ask you. Because so I can invent any case. What I want you to take away from this is principles. So whatever they ask you, you will have a principle that will decode what they're asking from you. Because if I mean, we can go forever with the case studies, right? So you feel 5 to 8 points is sufficient to address. You don't want 3 points. You don't want more than about 5 to 8 in your answer. With explanation is. I would say yes, because they're assessing. Do you know your stuff? They're assessing your competencies. So, for example, if you put like out of 8 points, 6, they have nothing to do with the flow of the blood and chi into the head. So venal return, they're going to deem you incompetent. They'll say, well, okay, he or she knows points, but this is like we're talking about Italy, they're talking about Congo, right? So you're not competent. So I would say, yeah, 5 to 8 points would be enough to really judge, are you there or you're not there? Yes.
Several of my other books, when we differentiate by syndrome, this one differs from it. Like this one will often give way more.
Mm-hmm.
Is that pretty standard for what they want to test, this many, or is this doing more than you
Well, if you look to their website, they're hinting what they want, right? There's that one case scenario where they, give you, I think it's a female patient, right? And they basically, it's actually a snapshot of a BC Doctor of TCM exam. So the level was actually Doctor of TCM, that they extracted one scenario and gave you the answers. So idea was that you're going to recognize what's going on there from the scenario, and they'll give you some basic, what we call marker signs and symptoms. So right away you can narrow it down what's going on in sense of it of the disease or illness or condition. These are interchangeable. And then right away you're going to be able to sort of sort it out, one or two syndromes they're like pointing to. And then based on this, you're going to basically decide the treatment principle, which is just reversing the flow of the information. You acknowledge in your treatment principle the illness or condition or disease and the syndromes, or syndrome if it's one. And then you just basically says, what are you going to do with them, right? So, and then you would, if you're acupuncturist, you would add acupuncture protocol, right? 5 to 8 points, 10, 12 if you want, depends on the time. I would say keep it short, but don't go too short, right? Because the idea is not to show them that you're really great with picking the points, but that you know your stuff. They want to see, are you competent? And more so, they want to see, are you safe to the public? College primary role, as you know, as I'm assuming some of you are regular health professionals in some other professions, is to protect the public. And that means they have to know that you're not going to maim, kill, or in any way injure a member of the public, because they're extension of Ministry of Health and Long-Term Care, and as such, as a government agency that sort of looks at arm's length and independent, their main role is protection of the public. So if you come in some TCM or acupuncture clinic and something happens to you, you would go to them and complain about the client, probably even before you go to court and sue them, right? So the main thing that you have to keep in your mind when you're writing acupuncture formula, TCM formula, treatment principle is the safety of the patient. And then everything else. Clinical competency, clinical efficacy, and so on and so on and so on. But the safety comes first. So for example, lots of points, or a particular point we use a lot in things like headache is the gallbladder 20. right? Fairly common point, but the point that could be potentially dangerous to the patient. If you have long enough needle and you know right angle, you could maneuver a needle to enter magnum foramen. So the opening where the spinal cord enters the midbrain and forebrain, right? So where respiratory center is. So even touching it a little bit will alter the breathing physiology of the patient, may not stop their heart. So there's a potential for injury. Well, let's not go that far. We're here to heal, not to kill. But yes, in some way, yeah, we could argue we could kill a person. And this is a very common point that we would use it a lot. So it's not a point we would use once in a few months. It's a point you use it probably almost every day, right? Feng Men, like it's a point that even in name it tells you that it's about a local circulation, relaxation of the occipital musculature, allowing more oxygen and cerebrospinal fluid to enter and pass the blood-brain barrier, bringing more blood into the brain, relaxing the person, activating parasympathetic or rest and relax division of peripheral nervous system, so on and so on and so on. We can write a book about this point, right? So it's a very universal book. So when you include this book, when you include this point, the thinking is from their part is, okay, is this point needed? And how safe this patient will be from this practitioner? Will this practitioner, so that means maybe even angle. If you have a time, I would write angle and depth to specific dangerous points, so not to every point. Like large intestine 4 HERGU, I mean, you're not going to kill anyone with this point. Sure, you may needle a nerve or something there, may be very uncomfortable, but I don't think no one's going to die from this point. So knowing that you can, yes.
I've never seen that on any of the practice exams.
I'm just giving you this as a tip. So like there's probably 5 to 7 points where I would maybe put a depth and the angle, just so you show that you're safe and competent, and that beyond the doubt puts to rest to them that you know your stuff. So it's not a big work. So you got to isolate about, I would say, no more than 10 points of all complement of points that we use in acupuncture. The really good book about that is, do we have internet here that I can? Okay. So I'm going to just recommend one book that's written by former chief examiner for BC College of TCM. And how to run safe and effective acupuncture clinic. I believe that's the full. It's a sentence for the book, yeah. And successful acupuncture clinic, and then just put a book. Just want to see if I got the right name. Amazon will probably bring it up right away. Let's see. Yes. If you can just project for them, can we? Yeah. So this is the best book that you can read, because he's both doctor of TCM and MD from China, and he wrote most of the board questions and exams for British Columbia, and we most likely will use the bank of those questions from BC, and BC copied that originally from California years ago. Not quite as per for Canada, but yes, as for US because they existed like in regulatory sense for many years, right? I think it's 30 years now. Yes. Exactly. So there's several of them. I'm going to bring actually a few books. If you just give me 1 minute, I'm going to grab them from the library. Hey, how are you? Okay, so here are the number of the books that you could purchase it. So the first one from Blue Poppy, 70. Yeah, you've probably seen this one. So he reviews the theory, practice. It's a U.S. based. Okay, so this is where NCCOM exam is extracted from national exam for the U.S. that every state writes in the U.S. but California. California has separate exam. Yeah, absolutely. I'm going to leave the books here. So on a break, here. I mean, I can even pass it around so you can see it. There's a book that actually is more specific to Canadian questions. So these authors extracted some of the questions or similar questions from British Columbia exams. So this is Canada specific. And this is available as well on Amazon. I'm going to just pass it around. And then there's a series of questions, study guides. So TCM diagnosis, study guide for acupuncture, herbology, volume 1 and 2. So there's a number of books that you can actually draw the sort of like a sense of what a strength or form of the question may be. Unfortunately, because we only have 2 years of board exams here, provincial board exams, or federal exams, if you will, because they're written up pan-Canadian, right? We don't have really good sense of where exactly things will go. No. No, at this point, not. Maybe in the future, yes. You have to understand that we're a new kid in the block in a sense here. Even the TCM as a medicine is 5,000 years old. It's regulated in this province only a few years. And even it existed from 50s and even maybe earlier here in Ontario and in North America. It's just, you know, in legal and regulatory sense, it's very new. So, you know, lots of things will need to be updated as we go around. So, in a sense, you're the early pioneers who are tracing the route for other people. Now, the good thing is that because you grandparented, you have an easier job in a sense because you will be allowed to carry this with you. So you can bring a stack of all the books and put it on a table. While the regular students cannot do that. They have to literally memorize everything. So they got to show full competency for acupuncture level, for TCM practitioner level, and the future for TCM doctor level, right? So I would say, but that first book that I show you is a fantastic book because it has the one that we were showing you on a internet. Oh, I'm so sorry. Melinda's going to just show it in a second. So it's an amazing book because it packs so much information for a little book. Because it goes through ethics, goes to safety in terms of needling, the angling, the depth, lots of things. And this is original material how the BC College of Traditional Chinese Medicine, or CTCMA, started. And Dr. Hong Zhengzhu, he was a chief examiner, so running a safe and successful acupuncture clinic. The book is, definitely not this. I think you can buy it on Amazon, probably .com, not on, I guess, Amazon.ca. I think the book is about $40 or $50. You know, don't look at these Canadian prices. This is like ridiculous. It's not. Yeah, the regular price is about $40, $50. You can buy it for Red Wings, you know, that U.S. distributor. So you don't have to go to Amazon. So I don't know why they put it these ridiculous prices there, but you know, I would say a book is worth this kind of money, like in terms of clinical thinking, but not for you actually to pay it, right? So I think the real price is about $40, $50 for the book. No, I don't think we have this one. This was just something that we had it for the school. But that book is also available on Amazon. So whatever we're showing you here, you can buy it from Amazon or similar websites. You just need a name, right? And just type it in and look for the cheapest version, of course, right? Amazon.com instead Amazon.ca. That's a Canadian website. Or if Amazon.com, the mother site, is still ridiculously priced like this, go to Red Wings. I don't know if you know of them. They, I think the Red Wings is it's U.S. Arizona or New? Yeah. So exactly. So they're the largest distributor of TCM books, Oriental Medicine, acupuncture books. I think they're based in New Mexico or Arizona. I'm not sure. One of those Southwest states. We routinely purchase books from them as a school, and they're okay priced. Like they're not, you know, too high, not too low, somewhere in the middle. So they definitely have this book. So let's go back to our own thing. So please do not hesitate to ask any questions. So let's go back to our headache. Okay, not a problem. So amazing book. You will be consulting this book well into your practice because there's so much good information here. Trust me. I do. No. Please ignore the prices. I don't know why they put it there. The book is actual price is about $40, right? You can even buy it electronically. Like if you want ebook, it's available. No, I'm just saying it for your own practice. This, yeah. For the exam, you should probably bring printed one. So out of curiosity, how many of you acupuncturists, and how many of you? Let's start with TCM practitioners. How many of you are going for TCM practitioner? I get okay. So basically, 100% acupuncturists. Okay. Sure. Okay. So one of the first thing with the headache is acknowledging it. So that will be so when you get scenario, they may not tell you this. I don't know, a 38-year-old woman has a headache. They'll tell you signs and symptoms. I'll tell you maybe she has a pain that radiates into the head. And they'll invite you to make a diagnostic opinion or state a diagnosis that she does have indeed headache or something else, right? So the college will not, I repeat, will not tell you that the bing, the disease, illness, or condition. So there's three interchangeable terms the college uses. You'll need to state that yourself. And in that stating, you're either right or you're wrong, right? How do we know we're right versus wrong? Well, because all the signs and symptoms are pointing predominantly that that's condition or disease. Beyond other 2, 3, maybe they may be there, right? So once you do this, the bing level, and you define it's a headache, for example, in essence, 30% of your job is done. Now you have to splice it or like fine tune it what level of this headache or condition or pathology you do have, and that's when you do the Jengbing, like or syndrome or pattern differentiation. So these two are also interchangeable, pattern or syndrome. And pattern and syndrome are set of the signs and symptoms, including tongue and a pulse, that set a specific, if you will, for lack of better words, flavor on that visit. On a Monday, 3 o'clock, the patient came. That it has a flavor of that particular headache. The closest thing in Western medicine would be defining a headache through anatomical sort of sense. So MD would say, okay, the person has a headache, and it's frontal headache versus occipital headache versus temporal headache versus migraines or so on, right? So in Chinese medicine, we use instead. So we may acknowledge anatomical sense, but we would actually go even further down and specifically narrow down that person has, let's say, wind cold headache, right? And then right away, few points should pop in your head, or you can consult the book and says, okay, if I think the person does have a headache, and based on signs and symptoms, tongue and pulse that they're presenting to me, has a wind cold headache and not wind heat or something else, then these are the points I should use. But before you go to the points, you got to state the treatment principles. So if you know now information, the person has a headache, it's a wind cold headache, right away treatment principle comes as I mentioned before. Reduce the headache, so acknowledge the disease, scatter the wind or remove the wind, disperse the cold, and reduce the pain in the head, if that's one of the signs and symptoms that they're mentioning, right? So in a treatment principle, you demonstrate to them that not only understand the whole process of Zhenduan, diagnostic differentiation, but you acknowledge the disease and the specific presentation of disease that is called syndrome or pattern. And then now you would go to acupuncture treatment. You would put, I don't know, 5, 6, 8, 12 points. You would explain why these points are used. And then if you're TCM practitioner, naturally, you would also state the herbal formula. You may want to put the herbs that are in the formula if you have time, if not just the formula, and in what form the formula comes. Tang, decoction, WAN, W-A-N, pill, SAN, powder, right? And what it would be a dose prescription, twice a day, 3 times a day, after meal, before meal, so on and so on. And the dosing itself, if it's decoction, maybe how many milliliter, if it's the pills, is it 2 pills, is it 3 pills, is it 3 tablets, and what one tablet or pill would usually have. Let's say if it's a tablet, I don't know, 500 milligram of tablet. What is the standardized prescription? Now, standardized prescription does not exist in TCM. Every manufacturer does different. So you're there. You can offer your own sense of how big those should be for average adult. Average adult, male, female, between 60 and 80 kilos. So how much of saturation per bloodstream if your TCM practitioner would be in? Since most of your acupuncturists, you don't have to worry about that. Well, okay, so we have to go back to the acute, subacute, chronic presentation. So in pain management, we're dealing mostly with two. Most of the time we ignore subacute stage, right? So we deal either with acute episode, it's purely acute, or chronic, or acute episode within chronic presentation. Right, so it's the interplay between acute and a chronic, right? So naturally, with acute presentation, it's a more aggressive treatment, closer to each other, so 2 or 3 times a week, right? Because there's acute pathology, right? And the patient usually and you use numeric pain rate scale, which is universally agreed scale in any form of medicine. So it's 1 to 10, 0 to 10. So acute headache usually it's 6 and higher. Chronic headache, usually it's lower in intensity, so it's usually about 4 to 8 range, roughly, right? Okay, so acute is generally first few days. So few days. So I'm purposely saying days, I'm not saying hours. It's usually an adaptation phase of first few days. After that is subacute, and then weeks. So subacute is between few days and a week. And then after that, obviously, it's a chronic. Early chronic, later chronic, and so on. Chronic presentation, generally, we're looking at once or twice a week, mostly the once, because of time and money, right? For 4 to 5 weeks till we see how the treatment works. Naturally, between your passive care, so stuff that you do to them through needling them, acupuncture, you would prescribe some self-care. Maybe self-acupressure, self-massage, sleep hygiene, like, nutrition, what food should trigger it, headache, and therefore should not be consumed, what food should actually alleviate the headache in sense of hydration, increase blood circulation to the head. For example, cinnamon is a universal blood thinner. And when it's used, as well as ginger, can increase actually the circulation to the head. So nutritionally, if it's used in a soups or whatever stews, it is sort of like seen as a nutritional prescription. Naturally, if the person is hypertensive and has a liver young rising that causes the headache, you wouldn't give them that, right? And that's where they would look for you. Are you safe? Do you know the difference that what some of these things would do? The ones that would help if you have blood stagnation and would move the vascular flow up into the head, or you have something that's hypertensive and you would make things worse. So you're not safe to the public. Unfortunately, I cannot. I'll tell you why. We can only be clear in a sense that if we're given a clear parameter, like if the live person would be in front of us and we can actually specifically define for that person at that moment what that stagnation would be for them. Naturally, for learning purposes, Chinese use umbrella terms. Umbrella terms means what you've just said about everything, right? So that they'll pile all the physiological and pathological kind of information together under umbrella, and they'll leave it to you to sort of differentiate according to encounter at the moment. So exactly, which makes it sometimes difficult to be very specific in this kind of environment because we're lacking the person we need the most, the patient, right? So if we have a patient, then we would look tongue, pulse, palpate, ask questions, even smell them if we can smell the odor or something, or breath or whatever. And then based on that, we would differentiate exactly what stagnation means to that male, female, child, senior. Okay, so that's why it's almost not fair to, like, for me to say specifically one or two things because it means more than that. So it needs to be seen in the context of specific case. So generally, if I can just differentiate a bit or bring a bit more clarity, Qi level is usually neurological pathology. So when we talk about Qi stagnation, it means afferent and efferent problems in terms of movement of the impulses from the central processing unit, the brain, or we call it cerebellum, to periphery, right? And movement of the information from periphery to the brain. So some kind of disruption of the flow, either slower, faster, definitely not synchronized, a lack of, right? So we see this as a functional pathology. Absolutely. Exactly. Yes, but it could be a faster in a part that it's not stagnated, so before or after stagnation for a time being. So it's a multi-pathology within pathology, and that's why they use umbrella term, because Chinese were one of the first clinicians in the history to recognize that life is messy medically, right? Your patient is not going to be textbook patient. But for sense of learning, we're going to clear all the mess. We're going to make it simplified in a book so we can all agree on it and we can discuss it and learn the basics. And then students mistake this for the real life. Real life is not that simple. As you probably all know, when your patient comes in, it's a multi-systemic pathology. If we would put that kind of patient in a book, everyone will run out of school. Because first, they wouldn't get a quorum, like what the basics is. So we simplify it. So do not mistake the textbook for the real life. It's just the first step to understand the real life mess. So Qi would be, Qi stagnation is afferent efferent functional disruption of the peripheral and central nervous system. Blood stagnation is deeper pathology, so it usually happens after the Qi and becomes structural pathology, right? And affects the flow of the fluids, not just the blood. It's always mistaken that it's just the blood. Blood is just one of the central fluids in the body. So could affect the cerebrospinal fluid, could affect surfactant fluid, it could your internal organs, pleural cavity like synovial fluid, production of the tears, production of the sweat. So it's a stagnation on a fluid level, whatever fluid is, right? Even we say blood stagnation. Because as you know, the part of blood is the plasmic part, right? The watery part of blood, and that's the fluid, right? So I'm not talking about red, white blood cells and everything else there. But in the case of immediate trauma, like I'm shoveling snow, I slip and fall on my left glutes, right? Immediately, within like first 30 minutes, I'm going to get both. I'm going to get Qi and blood stagnation, and it will be visible as a bluish bruise, for example, right? And I will have elements of Qi and blood stagnation. So pain and numbness that may or may not radiate down the leg. Depends, is there a compression of sciatic nerve or any other transmitting nerves? Nature of the pain may be different as we progress with time, from maybe diffuse to stabbing, from stabbing to diffused. Pain strength will go up and down, right? Depending, am I still staying outside? Am I carried inside? Am I having intervention or not? Right? So I may have both at the same time, or it may progress slowly. Textbook. We may also jump below and not have much of a Qi stagnation and go into blood stagnation right away. If constitution allows it, if you're born with that kind of organ deficiency from the birth, yes, that would play even more into it. If you're not, it may be channeled differently, right? So that's why they use umbrella terms when they describe things, because they recognize that complexity of the medicine. The medicine is not clear-cut. Naturally, for exam, they want you to be clear-cut. So they want you to narrow it down. So we're going to try, and that's why Professor Wu wrote this, to narrow it down. But please do not, I want you to understand this is not at all the all-encompassing representation of the medicine, or TCM in this case. It's just something to help you to understand this and have them understand that you understand medicine to the level that you're safe for the public. So this course is not about teaching and learning whole TCM. It's reviewing of the basic principles and how safe you are when you addressing them and executing them on a member of the public. Right? Because we have so little time to cover so much. Right? So I would suggest, if you want to learn more in depth, there's this school, there are other schools, there are books. So if you feel like that you want to go more in depth, that's probably the best way. Okay, so when So here we go. So we saw first wind cold and wind heat. So I'm going to just glaze over it, and then we're going to go and look them a bit more in detail. So number 3 is wind dampness. So these 3 are externally contracted. So Chinese first division it into internally and externally contracted headache. So externally contracted is usually due to external pathogens. So environmental pathogens, things like wind, cold, dampness, dryness, heat. Yeah, I think that would cover it. And usually the wind is the one that carries it, and then there's a and that's so it's a carrier, and then there's a flavor of pathology, which is like cold, dryness. In this case, is dampness. So each of these carries a slightly different headache. So, for example, wind cold, being more yin in nature pathologically, means more denser pathogen, viral, bacterial, protozoan, or whatever. Will have affinity for opposite physiological part in a body. So if wind cold is yin in nature, more dense, it will seek the yang part of the body. The yang part of the body is posterior part of the body. So it usually results in occipital headache 80% of the time. So we would say that wind cold will cause occipital headache. Wind heat, that's quite opposite. Wind heat is the yang kind of pathogen, less dense. So it naturally has affinity for the front of the body, which is the yin part of the body. So opposites attracts, we would say in this case. So the wind heat will cause frontal headache 80% of the time. Wind dampness will cause the whole head headache. So the general description in most of Chinese books is patient will come and says, listen, I have a headache and it feels like someone took a wet towel, wrapped it around my head, and it's wringing it in a vice, like wringing the towel. So I have like my whole head feels like it's a pressure headache, right? And it's like being compressed. And that's the wind dampness, because it causes the phlegm-like condition. It's binding the, so in a biomedicine, and I'm not going to go too much into it, it messes up blood-brain barrier relationship in the head, right? So the nutrients and oxygen does not pass as well blood-brain barrier, and there's a vasoconstriction in the whole brain, right? And that's why the sense of like someone is compressing your whole head, and there's no loci of the pain, like as the front, sides, top, or the back. So right away you can tell if they're telling you, okay, I don't know, 37-year-old female comes, complains of the pain that radiates from the neck into the head, pain radiates in the frontal part of the head, and then you look for the other confirmations, because they'll give you probably pulse and a tongue. And they'll say, pulse is superficial, fast, tongue is red and no coating. So right away, like 2 things they told you right away. No coating means heat. It basically dissolved the body fluids. And the fact that the pain is radiating to the front of the head, it's most likely headache due to the wind heat, not wind cold, because it didn't go for occipital. Of course, they could play dirty and say it's the pain is felt everywhere in the body. Patient is describing the pain in the head as head being squeezed in the vice, like a device. So that means it could be a wind heat, it could be wind cold, it could be, however, more specifically, wind dampness, right? But what will tell you what it is? Usually pulse and more specifically tongue, because we always look at pulse and tongue in TCM. And it's like a sort of internal imaging peekaboo for us to look inside, because we don't have X-rays, we don't have ultrasounds in TCM unless you work in China, right? So traditionally we would use the pulse and tongue being the only internal organ we can actually physically see, to tell us what is going on in the body, like our imaging, in a sense, our lab work. Okay. So the next one is headache due to hyperactivity of liver yang. So this is usually a hypertensive type of a headache. Generally, patient is having ongoing high blood pressure, right? May or may not be rooted in cardiovascular issue. Definitely is rooted in the way the liver is working. So liver is not metabolizing blood properly, specifically pH of the blood. pH of the blood is not processed to proper 7.2, slightly alkaline. Instead, it's probably under 7, so it's acidic. And because of acidic state of the blood, chemically, the lack of certain bicarbonate ions in the liver and in the bloodstream causes the hypertensiveness. Now, hypertensiveness can be rooted in a cardiovascular stuff, heart, neurological, which we usually say it's a liver, right? Liver represents neurological, especially peripheral nervous system, the way the Chinese see it. And there's this sense of like something like erupting like volcano. So the person will tell you like, or the scenario may read something like, you know, a female or male patient comes red in the face, irritable, has a halitosis, bad breath, maybe even bloodshot eyes. So bloodshot eyes usually hints on hypertensiveness. Pulse is rapid, fast, and possibly wire. Person is impatient to get on with the treatment. They don't like to be questioned. She or he states they work in usually some kind of highly stressful occupation, like a lawyer, first responder, stuff like this. People who are constantly, you know, slammed by the stressors. You know, not like your typical librarian or something like that. No offense to librarians, right? So this is usually what we call hypertension-driven headache. So right away you know that this is excess headache. Now, it could be fake excess, like yin, kidney yin, liver yin is not holding the liver yang, so liver yang just floats up, or it could be true excess, where liver yang is so overpowering the liver yin, so it forcefully raises up. The difference is usually that the true excess liver yang will cause bloodshot eyes, constant redness of the face, and hyperventilation. The fake, so the liver yang that floats up, as the Chinese would say, it would cause probably slight redness of face, not so much of bloodshot eyes, and not as a rapid breathing rate, right? And the pulse may be similar. The next headache is due to kidney deficiency, most likely to kidney yin deficiency. And there's a kidney yin, kidney yang. Kidney yang is adrenal insufficiency. Kidney yin is general systemic dehydration in the body. So this headache usually have side symptoms such as the low back pain, low pitch tinnitus, knee pain that accompanies it, right? Number 6 is headache due to deficiency of qi in blood. So this is general deconditioned state in the body. So the person is lethargic, immunodeficient, not much circulation to periphery, so cold hands and feet. So basically, there's not much blood coming via the front carotid artery or the back, magnum foramen, into the brain. And as you know, the brain is biggest junkie for the oxygen in the body. It's the biggest user of oxygen. If the brain doesn't get oxygen together with the nutrients, the brain will give you a headache. Right? It's a basically negative feedback from the organ, in this case the brain, telling you I need more. And then naturally, let's say if it's occipital headache, we rub the neck, we release some of the musculature, we get more oxygen via cerebrospinal fluid, and the headache lessens, but it never goes away, right? So there's an instinctive play between us and the brain, if brain could be a person, right? Number 7, headache due to retention of the phlegm. This is a long-term problem where the lifestyle plays into it. So this is usually overweight person who eats what I call 3 W's: wrong food and wrong time in wrong quantity. So it's a lifestyle that plays on us. Person who works whole day, comes home, doesn't eat through whole day, and then just hits something like steak and potatoes. So it's the wrong food at wrong time in wrong quantity. Overwhelms the stomach. Eventually they have gastrointestinal problems, which Chinese say that damages what they call spleen and stomach system, which includes pancreas. So the pancreas is forced to inject too much insulin at a few times a day instead smaller quantities, leads to diabetes, leads to deficiency in the spleen, movement of the lack of the pumping action of the spleen to move the fluids up to the lung, and the long-term dampness matures into the phlegm. And phlegm is like physically, if you would see it, like as the Chinese describe, it's almost like a mayo being injected in a tissue. So we never remove phlegm directly. We downgrade the phlegm into dampness, and then through diuretic means or sweating, we remove it from the body. So if anyone tells you they can remove the phlegm right away as per TCM guidelines, they're lying, because phlegm is long-term pathogen that are matured, right? So it needs to be downgraded before dealt with it. So this kind of headache is similar to what we described, like being wrapped with a towel and then squeezing the head into the vise. So it's a whole regional headache, and it looks like compressive. Headaches due to the blood stasis is usually to some kind of closed head trauma. So it could be your whiplash, could be, I don't know, slip and fall, could be also a chronic RSA, like a repetitive strain injury, some kind of movement that damages the neck and the shoulder and connection of the neck with the head, and the brain is continuously getting less nutrients and oxygen, so that attunes to a repetitive strain injury. And in this case, repetitive is a lack of delivery of the substance to the brain. So eventually the brain develops ischemic-like a nature, and we talk about it as a blood stasis. Right? So these are the all 8 that we cover. So we're going to go and look them a bit more in a detail. Okay, so here Professor Wu just tried to sort of give you a little kind of summary that you can put it there, because they will assume that you're going to get the diagnosis, you're going to get the syndrome, and then you're going to describe pathology of it in 4 to 6 sentences or less, where you're describing why you picked this. Because it's not enough they say, oh, you have a headache, oh, you have a wind cold. They want to know, how did you arrive to that? So you'll need to give them a little summary there, like a little chapter where you showing off and saying, hey, I'm a clinician, I know how this came to it. You gave me the information, but I will explain you back why I think that this person has a wind cold syndrome of the headache, right? So, he's saying a headache can be seen clinically in many acute and chronic conditions. You notice opposite of subacute, right? All kinds of pathologic factors of interior injuries may cause it, as well as the obstruction of collaterals, malnutrition of the brain. So that's what we talked about the last one, right? You don't get enough nutrients via blood and cerebrospinal fluids and oxygen. It's frequently seen in hypertension, vascular headache, encephalitis, meningitis, acute cerebrovascular disease, and glaucoma. So these are now Western conditions that we see headache as a part of, not necessarily as a headache alone, standalone, but headache as a part of a larger condition that they may or may not name it to. They may say this 37-year-old female patient has the history of hypertension. So now you're like wondering, okay, is it a hypertension they have as a disease, or is it a headache? So the way they're going to name it, usually from what I've seen in scenarios, they'll usually name the main thing immediately within first 2 sentences. Yeah. So like the stage is set, and then hypertension will be mentioned maybe in 3rd, 4th, or 5th sentence, that there's a history of it. So you know that the main disease is not hypertension, right? So we could say the person has hypertension, but secondary to, he has a headache secondary to hypertension. So hypertension may be one of the causes, but the disease, the main condition, is still a headache. And they may throw this in just to see that you recognize what's primary pathology, what's secondary pathology. And that's also a safety issue. Are you going to treat the real life-threatening pathology, or you're going to treat the chronic, maybe not so life-threatening pathology, and you're going to put the patient at risk? So even there is a layer to see, do you understand the medicine? In this case, TCM. So here he's going into like the major 2 divisions, right? So he says, the causes of headache can be external contraction and internal contraction. So, and then he goes on and he's mentioning the external contraction. The wind is the chief pathogenic factor. Wind is the carrier. And then we have 3 flavors of the wind: wind cold, wind dampness, and wind heat. They all invade head and block the channels and collaterals, resulting in a headache. Headache due to internal injury, 2nd division, are mainly caused by emotional distance, so stressors, the way we get stuck in certain emotional pathologies. So Chinese recognize that it's okay for us to feel all the spectrum of emotions through the day. In the West, we're not always so forgiving. So we would say, yeah, it's okay if I feel happy, if I feel joyful, if I feel grateful. But it's not okay if I feel hateful, if I feel anger towards someone or myself, if I feel envy and stuff. These are negative emotions. I shouldn't feel them. Chinese have a slightly different approach. They say there's not necessarily negative and positive emotions, and they right away give you example. It says, well, you're a father, you're marrying a daughter, and you're so joyful you get a heart attack. Is that joy now a positive emotion? No, sir. So there's no such thing as negative and positive. And how about this? You're in a fight of your life. You're just swimming and the shark attacked you. And your children and your wife are on a beach. And you're getting angry because you don't want to die. You want to see your children and your wife. You want to live. And then anger gives you extra strength to punch that shark in the eye, and shark backs away, and you get the new lease on life. So is that anger a negative emotion for you? I guess not, because you just got a new lease on life. So Chinese believe that emotions are just that, emotion, a neuroendocrine response in the body, hormones that stream through our vascular system and the tissue. And as such, it's okay for us to go through them. So it's okay for you to feel a little happy and maybe angry and whatever, as long as you don't get stuck in emotion. If you get stuck in emotion and you constantly experience that emotion, whatever it is, as in joy or anger or something else, you will have pathological response in your body. Therefore, this is what he's playing on it, that he's saying that if you have emotional distance, the emotional distance is emotional stuckness, you will have pathology. And this internal pathology will cause a vascular response, neuroendocrine response, and so on and so on. It will damage the flow of the blood and qi in your body. It will cause some form of a headache, which will be colored by the flavor of some organs that are either hyper or hypo, so either excess or deficient, right? So he's going on. He says, it may lead to failure of liver to maintain free flow of qi. And as a result, hyperactivity of liver young. So we have hypertensively led headache. Also, deficiency of kidney yin, weak constitution, and insufficiency of kidney qi and blood. Blood in this case is liver blood, may cause the brain to be malnourished. Not enough stuff delivered past the blood-brain barrier. Or the preference for fatty and sweet food may produce phlegm and dampness in the body. So eating wrong food at wrong time, wrong quantity, and not exercising. We get overweight, we get lots of elevated cholesterol, and so on and so on. And it leads to what Chinese call phlegm and dampness, and that's obstructive and obstructs the brain collaterals. So obstructs the delivery, again, of the nutrients. In this case, Chinese use the term blood and qi. Or failing down and external injury may cause the qi stagnation, blood stasis. The scenario we talked about, slipping while shoveling, right? So headache can be caused by all these factors and can be result as a part of external or internal injuries, right? So internals are mostly emotionally driven. Externals are mostly contracted. And I would argue that maybe third one would be miscellaneous or traumatic injuries. So like closed head injury. So external force hits you, like you slip and fall, you're impacted by something, and so on and so on. So maybe a third division, right? So chief symptom, persistent headache radiating to the neck and the back, sudden onset. So this is headache due to external contractions, wind heat, wind cold, wind dampness. Three subdivisions here, right? So you get persistent headache, it's radiating somewhere to the neck and the back, or to the front from the neck, right? Sudden onset, it may be accompanied by external symptoms caused by external pathogenic factor, your virus, bacteria, protozoa, I don't know, H1N1, right? Like influenza or something. So pattern of this headache can be caused by wind cold. So it's aversion to wind and cold, absence of thirst, thin white coating, and floating and tight pulse. And I would add headache would be mostly in the beginning occipital, right? Because of affinity of wind cold yin pathogen for the yang side of the body. So you'll first feel tightness of the suboccipital muscles, and the original nature of the headache here would be described by patient, if they allow this in your scenario, as occipital headache, right? If not, you're left to sort of guess, looking through pulse and tongue. Pattern of headache caused by wind heat is accompanied by the standing sensation in head, fever, thirst, and preference for the drink. You'll notice there's not much preference for the drink of wind cold. So one of the things that differentiate between wind cold and wind heat is the headache and also sore throat. There's, in the first 24 to 48 hours, there is no sore throat in wind cold. But there is sore throat and thirst in wind heat. Also, the tongue is different. Pulse is almost the same, so don't look at pulse. Tongue will be marked differently in sense that wind heat will be more red, and there'll be little or no coating and thirst with the sore throat, as I mentioned. The wind cold will be usually pale, a tongue slightly red with some coating, usually white or gray. So you know right away. And then there's, of course, sense of hot and cold in wind cold, and only sense of heat in wind heat. So floating here describes that pathogen just entered the what we call Taiyang layer, the superficial subcutaneous layer of your body, kind of like invader, and it's stuck in this subcutaneous stage we call Zuoli, and it's being met by your Wei Qi or your immune system, leukocyte, immunocyte of other kind, and then there's a fight going on there. Immune fight, and that's why we may or may not feel the sense of heat, sense of shivers like cold, maybe even sweat in a wind heat, right? And naturally, then we get tired. We get thirsty, and then of course, so pattern of headache caused by wind dampness is a bit of a first two, right? So you have a heavy sensation in the head, as in wrapped up. So that's the usually trademark. If you see wrapped up headache, you know it's most likely not wind cold, it's not wind heat, it's most likely dampness or phlegm based. You have lassitude, heaviness of the limbs, white greasy tongue coating, and soggy pulse. Now, white greasy tongue could be wind cold, but the soggy pulse means your body is, by the Chinese theory, has a lots of dampness in it, right? And you feel extra heavy. So there's a sort of absorption of the moisture in your interstitial tissue, and it makes you like bottom heavy, kind of. And with the head like too heavy to hold, right? Okay, thank you. So a headache due to internal injury. So this is now number of rest of them, right? So we cover first three, so we have now 5 left, right? The chief symptoms here are lingering intermittent headache with slow paroxysm, often accompanied with vertigo, and may be provoked and aggravated by exertion or emotional stimulation. So Chinese believe that if you under lots of stress, any even smaller stressor down the road coming secondary can increase the subjective feeling of the headache, pain, feeling of the sort of like a radiation of the headache, and or vertigo plus tinnitus, right? So almost you feel like acute presentation of Meniere's disease, right? So pattern of hyperactivity of liver young may be accompanied by distended sensation in the head, blurred vision, restlessness, irritability, flash face, flushed complexion, red eyes, bitter taste in the mouth, sometimes metal taste in the mouth, red tongue, thin yellow coating, sometimes no coating, and the wiry pulse. So we have hyperactivity of the function, and the blood pH, as I mentioned before, is slightly toward the acidic side. Pattern of liver kidney yin deficiency. Liver yang rising is excess pattern, and you see all the elements of excess in the body that's being moved up, right? And then here we say in the pattern of liver and kidney yin deficiency, a deficiency pattern. So this may be a more of a subacute chronic presentation, while the first one, liver yang rising, may be usually acute presentation, right? So liver kidney yin deficiency may be accompanied by vertigo, and tinnitus here is a low-pitched tinnitus. It's not high-pitched tinnitus, as in like liver yang rising, as in the previous one. That's a differentiation that you should pay attention to, right? And generally, blood pressure here, liver kidney yin deficiency, may be hypertensive, but not like, it's generally at the essential hypertension level. So about 140 to maybe 160 over 100, while with the liver young, it's usually 150 and higher. So even presentation of hypertensiveness is stronger with liver young because it's excess, right? So pattern of Qi and blood deficiency, so it's another chronic one, may be accompanied with headache with the void sensation, vertigo. Vertigo here is postural vertigo, right? Lassitude, general fatigue, Usually the tongue will be pale with the white coating, and the pulse is usually weak, sometimes described as a tread. You have a trouble finding it, and if you find it, it's usually deep, right? Pattern of the phlegm turbidity, this is excess now state. So maybe accompanied by a hazy feeling and dizziness in the head, oppression in the chest. So people are sighing, like they have trouble breathing it, right? And generally the coating will be thicker, maybe white or gray, greasing, kind of looking with the root. So it's like kind of like someone put it like a, I don't know, yogurt over them, but it's slightly gray, and it's sticking for the tongue, like he has a root, right? So it points to the chronic nature of it. And then pattern of collateral obstruction, so blood stagnation, may be accompanied by fixed pricked pain. So you feel like someone stabbed you in a particular part of a head, and generally your tongue may look purplish. You may have a history of the varicose veins, cardiovascular conditions, stuff like this, right? Your pulse is generally thready and sometimes like almost feels obstructive, like it's like being squeezed to the blood vessels, right? In addition to this, headache can be diagnosed by anatomical or channel identification. So we're talking about things like Yang-Ming headache, which appears in a forehead, right? We're talking about Shaoyang headache, which is a lateral temporal, right? We're talking about Taiyang headache in occipital region, right? And Jueyin headache in the vertex, right? So let's repeat it one more time. We have Yang-Ming headache at the forehead, right? We have Shaoyang headache at the temporal state or side of the head. We have Taiyang headache at the back, and we have Jueyin headache at the vertex, right? So front, back, top, and the sides of the head. And then phlegm has all combined together. So even by location, we can tell what's going on. So the treatment. So Dr. Wu had here like the basic points. So he said, listen, when you deal with the headache, here are the like points that will work most of the time for it doesn't matter which of the syndrome it is. So it's like a face saving in a sense. Like if you put these points, you're seeing like you know what's going on as long you describe why they're working, right? So for example, bike weight, the highest points, right? Do 20. Taiyang, sides, right, the extra point. Fengcher, that point that we're talking about, the gallbladder 20. And Luque, lung 7, the distal point, the systemic in nature, will work for headaches due to external contractions. Those three, wind heat, wind cold, wind dampness. So these points that you see here, these 4 points, are your like main formula according to TCM. Are they the best points? Yes and no, but they're accepted points, and that's what's important for your exam. Are you going to use it in your practice? Maybe, maybe not. But we're not in your practice. We're preparing you for the sort of, augmented board exam. Now, you can add other points depending on what else is going on. So this allows you to cover externally contracted headache right away. So it's your basic 4 points. That's why I mentioned 4 to 6, 4 to 8 points. Now you're going to add filler points so they can tell that you also know and you're safe to differentiate which of these we're talking about, right? So add Fengmen, bladder 12, for headache caused by wind cold, because the headache from wind cold goes from the back and the lung. Add large intestine 11, sorry for the typo. Add that, do 14 for the pattern of headache caused by wind heat, because these are the venting points, large intestine 11 and do 14. Add spleen 9 for the headache caused by wind dampness, because this is a draining point for moisture in the body, right? So you can add this according to any of the 3 in addition of the 4 you saw up there. So now it's explanation. So Bai Hui, do 20, and Taiyang are selected to smooth and direct channel qi out of the head, because what happens is once your head gets attacked, it means all of the stuff is moving up into the head and it gets congested in the head. So these 2 points are basically decongestant points. So they move the blood and qi out like they reestablish basically a normal flow in and out, not just in and then congested it, right? Um, uh, Gallbladder 20. Um, I don't think we mentioned gallbladder 20. Oh yeah, yeah, gallbladder. Crossing point of foot Chao Yang and Yang linking vessel. So this is the point that we're talking about being safe if you angle in a proper way. So the tip of the nose and use maybe 1 Chun needle, 1.5 the longest, depending on who you're needling, how big their head is, how muscular they are. But I would say if you go 1 Chun minimum, especially with people with smaller heads, there's less chance that you can reach the magnum foramen and therefore do anything nasty to the person. Um, some books says that you angle toward the opposite eye. I would say it's actually safer if you angle for the tip of the nose. Just FYI. So this is a point it has a many, as I mentioned before, many functions. It decompresses the local circulature, local musculature. It increases circulation into the brain, and the Chinese would say it removes the wind. Wind is basically in this case external pathogen that causes vasoconstriction of the musculature and circulation around that area. Lung 7 here is lual connecting point of the lung, because lung is that superficial organ that gets attacked by these three pathogens: wind, cold, wind, heat, and wind dampness. So basically, it regulates the respiratory functions, especially of upper respiratory functions, not the lower one. So therefore, it helps the lung expel exterior pathogenic factor. You may also use some Usher points, which means local myofascial trigger points around to help to reduce the tension, increase the blood flow, and reestablish the tissue health. Headache due to internal injury. So this is now emotional stuff and possibly traumatic, like closed head injury, whiplash, and so on. So the 4 points here are the bike way that we saw, stomach 8, right, the corner of the forehead, Fengcher, gallbladder 20, and the major systemic point, stomach 36, right, Susan Lee, and any other local Usher points you may want to add. And you usually sell them as Usher points. You don't put myofascial trigger points. We're not Western medicine. So we call them Usher points, local tender point. So you may add additional points. So for example, here are Yuan source points, original energy points, right? Liver 3 for the liver and kidney 3 for the kidney, for the pattern of hyperactivity of the liver yang. You can add stomach 40 Fenlong and the spleen 9 for the turbid phlegm and dampness. Spleen 6 and bladder 17 for the blood stasis, and Shuhai, right? And then you can also combine Shuhai actually and bladder 17 would be better combination, but this is great too. So you can also combine spleen 10 and bladder 20 for blood deficiency. So there's a difference between blood stagnation and blood deficiency. So the difference is that blood deficiency is the possible mother pathology of blood stagnation. So blood deficiency will give a birth to blood stagnation 70% of the time. And only 30% of the time, there will be a blood deficiency will be secondary pathology stemming from blood stagnation. What's the difference? Ongoing blood stagnation, a month or longer, will give a birth to blood deficiency, like anemia-like condition, if it's long-term, in 30% of the time. Shorter weeks pathology, days, weeks, in 70% of the time, blood deficiency that runs only for weeks or days will give a birth to blood stagnation. So let me repeat this one more time. If you have a pathology that's a blood deficiency, anemia-like pathology for days or weeks, it will give a birth to secondary pathology called blood stagnation or blood stasis. In the long run, the blood stasis, months and on, will actually produce blood deficiency. Okay. Of course they are. Everything's interconnected. We may call this United States of America, where each state is for, but it is a one country after all, right? Absolutely. So the short-term blood deficiency, days or weeks, so no more than 3 weeks, will give a birth to secondary pathology of blood stasis. long-term blood stasis, month and longer, so month and months, will give a birth to blood deficiency. So the time plays the role. Who produces who? Um, you're very welcome. So Ming Men, Du4, and Shenshu Bladder 23 are usually done when you have a kidney yin and liver yin deficiency, so which is a generalized dehydration state in the body, right? So these are the combinations. So now it's explanation. So Professor Wu gives us here explanation in TCM kind of language. So Do-20 nourishes brain and marrow by smoothing and regulating circulation of chi and blood. So he opens the blood-brain barrier. As you know, blood-brain barrier is made so only blood, oxygen, and nutrients can pass through, and no bacteria, virus, or any other pathogen can pass it. Of course, there are a few who can sneak because despite that, how small the blood-brain barrier is. So it's the only defense the brain tissue has against some kind of viral or bacterial outbreak. I mean, meningitis is one of those when you see it that actually that doesn't work as well, right? It actually works against us. So here, the 220 being a local point, but also highest point, is seen as sort of making that barrier more permeable. So increasing permeability of the brain tissue toward the nutrients and oxygen. So the brain then works better and removes the metabolites, the waste. And brain does have a waste, like any other tissue in the body, right? And I don't mean by thoughts. Stomach 8 is used to dredge the channels of the head, so the corner point. So basically what the stomach 8 does, it redirects the flow of the blood, right? And in gallbladder 20 here, it's used for one of their abilities, and that's to redirect more flow through magnum foramen by relaxing the musculature around. So occipital muscles, right? So they don't pinch the spinal cord and then they don't pull the back, sort of like in extension. Stomach 36 here is used to supplement chi and blood. So stomach 36 is here used to work on tunica intima. So there are 3 layers in blood vessels, right? Tunica externa, tunica media, tunica intima. Stomach 36 here, when it's particularly manipulated in order. So not only point is used, but it's used in a cascade after certain points. So when someone writes you acupuncture formula, it's not just what points they're using, but how sequentially they used. So it's like dialing the phone number. If my phone number is 1234 and you dial it, you'll get me. But if you, let's say, misplace the middle number, so you go 1734, most likely you'll get someone else. So what that means in a body, if you misplace the order of the point, the body will not react in a specific manner you want. It will still react. It will be what we call growth-specific physiological response. So you'll get someone else on the phone, but you're not going to get me. Right? If you dial the proper number, so needling points in the right order, from left to right, contralateral, ipsilateral, you will get a rightful physiological response. So when stomach 36 is used in that order, it can trigger 1, 2, or other things. Particularly here, it triggers the tunica intima vasodilation. So the blood is moved better, and that one way evolves through it. Right? Okay, so Usher points, if they're on Coumadin, if they're on major blood thinners, Coumadin, warfarin, Plavix, not so much aspirin because usually they take the baby one. Yes, they cause blood thinning effects. They cause vasodilation and thinning of the fiber. This is just a little tip I'm giving you. Yeah, sorry, I should predicate that. I apologize. No, order. No, it shouldn't be. Of course, well, they will actually, hopefully they'll state it in your scenario, what medication the patient is. And if they do state, that's actually a hint to, well, no, that's a draw to see what you're going to react, right? How are you going to react? Where is your clinical competency there? So they may say this patient who's hypertensive, has a headache that radiates from chest up to the a forehead, so and it's on these following medication because of long-term conditions such as. So they are setting you up. Question is how you're going to react, right? And reaction would be the point. right? So there will be like sort of tricks built in to see are you safe, right? I don't know if they're going to go to slaughter you, but there will be some questions within questions, right? Because remember, their major focus is safety, not the competency. When we say competence, it's competence through safety, not competence to do you know the TCM. And then secondary is, are you competent TCM clinician? Do you know your theory? Do you know how to do this? But safety is number one, guys. That's their mandate. Like it's mandatory by the government. Because I'll give you an example. If I tomorrow needle, I don't know, lung 2, and I collapse someone's right lung, this patient most likely will sue me. Hopefully they're not going to die. Once they recover, they'll probably sue. When they sue me, guess who else is they suing? OCTCM PAL. Why? Because they government issued certification agency. So on a court date, it'll be yours truly in a court, and they'll be representative of the college. They're lawyers because they're defending themselves. And they have to prove to the college that I passed the exam that you passing, that sort of highlighted that you are safe to the public, because they issued me a number certifying that I have minimum competency that would not do such thing that I just did, collapsing someone's lung. You're sticking needles in a people, you're deemed to injure them in some way. And that may be as something as light as bruising. You heard of panda eyes. You know, when you do facial acupuncture and you nick blood vessel around the orbital area and they look like a Rocky, like from the movie, you think that lady who's paying you 180 and not going to sue you? Maybe, maybe not. I hope not. Well, of course, you know, of course. Yeah, exactly. There is a possibility that you may be bruising in the face. And they may sign, but they will still sue. Same as when you OB and you deliver someone's child and they die of no fault of your own, and they still sue. Even they sign all the hospital forms. That's why OBs have a $28 million malpractice insurance. That's what I'm saying. We cannot guarantee humans will not do what you think logically will do when they're emotional. Yes. Protect you. No. Absolutely. Maybe, maybe not. We're not sure what their point system looks like. Okay. Okay, if you want to go that way, sure. I mean, it's your exam, obviously. I respect your opinion. I just said, in my opinion, I would probably add if I have time. If I have time at the end. If you don't have a time, then you just do basics, as you said, right? Define disease, define the syndrome, define the treatment principle, define the treatment protocol. That's the flow, guys. That's what they want. Disease first, syndrome next. Treat according to syndrome. Syndrome is particular presentation of the disease. And that got to be reflected in a treatment principle, like what you state in 1 or 2 sentences, acknowledging all, like where your direction in treatment is. I'm not sure if they're going to ask for frequency. So far from what it looks in exam, they don't look for frequency. 3 times a week. Okay, in that case, okay. So there is no exact. It's estimate. So estimate would be, in my opinion, if it's acute, it means 2, possibly 3 or 4 times a week for a few weeks, for sure, because that's how physiology works in a human body. If you just put once a week for 5 weeks and it's acute, I don't think that's going to fly. It shows that you don't understand how the body works, and you are into the medical field, right? So I think there are some umbrella kind of areas that you should fit yourself in. And if it's chronic, yeah, I may go once a week, once every 2 weeks for 5, 7, 12 weeks, whatever, right? That looks that you're respecting the chronicity of the disease, right? So, yeah. So flow is important. And it makes you save the time. You go 1, 2, 3, 4, boom, done. Next one, next one, next one. Let's review what I wrote. Let me see if I want to add anything. Right. Okay. So we use this one. So in a case of the headaches that are anatomical, or what we call channel distributed, so we're talking about Yang Ming, Xiaoyang, Tai Yin, Julian. So these are the combination of the points. So if we're looking for Yang Ming channel, what did we say Yang Ming was? So front. Yeah, forehead. So we are adding the stomach 8, and the distal point. So local and distal combination. Large intestine 4, stomach 8, right? In the case of headache along Shaoyang channels, where was the Shaoyang? The temporal sides, right? Yeah. So we're adding the gallbladder 8. So again, the local point, gallbladder 8, and then distal point, Sanjiao 5, Wang, right? In the case of headache along not Taiyang channel, sorry, this is a typo. I apologize. We're adding the local point, bladder 10, right? And the systemic point, small intestine 3. So you notice the local, distal, near and far combination, right? In the case of headache along Jueyin channels, we're adding the Shishenchong, so 4 points around Baihui, right? So local, so vertex, and the distal, liver 3. So near and far, near and far, near and far. Okay? There are alternate methods that you want to add, and they will expect you to add alternate because it shows that you're not just treating with body acupuncture, but you're competent to treat other things, auricular stuff, scalp, wrist and ankle. Maybe you do 7-star hammer. Maybe you do moxibustion or you do bleeding, right? So it shows that you have a full scope of acupuncture. Now, I wouldn't go too big on it. Add something, right? So pick one of the microsystems if you cognizant in that, and then add, right? If you're not sure, well, don't add nothing, right? So in auricular stuff, so you add antitragus number 4, antitragus number 3, 2 and 1, Shenmen, which is the triangular fossa number 4. You use either needles or Wangbuleng Sheng, like those seeds, Vakari seeds. So the reason we use Vakari seeds and not metal, this is just a tip for you guys, is because seeds over the 24-hour period release essential oils when mixed with the sweat, and we all sweat. They will not cause corrosive actions. Metal, like a magnetic sphere, they're either stainless steel or gold and silver plated, will react corrosively. Not all the time, but like after 2 days for sure. Titanium, probably not. Titanium are like a bit more resistant to the sweat reaction between the metal and the skin. So we usually use wobble and like the Vakari seeds because they release that sebaceous oil and it acts microbacterially with the sweat. And it's cheaper. The box is like $5. So you either do needle in office. We don't let them go home with the needles in the ear, or we let them go home with the seeds, right? On these points. And then we can do 7-star hammer. So we can do Taiyang, like with we can do either lancet or 7-star hammer if the patient gives you. So you explain it to the patient, and they're comfortable with you using the hammer on the sides of their forehead. So you can use that one. You can use the yin tongue, pricking it, or anything else. Right. So this is just a representation of some associated acupuncture, like therapies that could be used for a headache. So acupuncture is very effective for the treatment of headache, but if the headache doesn't improve with the acupuncture treatment, we can sort of add other things. But we also got a rule: is there acute or emergency like condition unfolding within the body? So this is a safety now. So looking at certain neurological or other signs in the patient. So if the pupils are dilated and a different size, we may suspect there is some kind of internal pathology unfolding in a patient. If the patient has convulsions, loses the speech, slurred speech, can maintain the posture, something were to obviously dial 911, and they can be transported to the facility where they can do life support, or they can have better imaging or something, and they could be stabilized or treated beyond our scope of practice. So if we think that there is something going on and we're not comfortable treating it, we're to refer, or in this case call the emergency, and they can be transported to the nearest emergency department in the hospital, right? So just because patient came doesn't mean we always treat them. We need to do sort of like a assessment, which is the part of our diagnosis anyway, right? So learning to recognize out of ordinary stuff is part of our knowledge as well, right? So some lifestyle advices: patients should quit smoking and drinking alcohol. They should sort of induce certain form of physical exercises where exertion is monitored. So, for example, with people who have a POTS, like postural orthostatic tachycardia or postural induced high blood pressure or something, hypertension, they may not do exercise like, for example, we give them qigong exercise where they, I don't know, bending over and scooping, because obviously this is going to make them worse because they're changing the postural thing, right? And they also, what they're doing is they're draining the head rapidly and they're engorging the head like with blood as they're changing the side, right? So we may give them some advices on that if they're hypertensive, I think depends how much they're going to give you in scenario to go for it. Yeah. They do expect you're going to give them some lifestyle counseling, right? So, like, you should probably limit yourself, but you got to go with the flow, what's given to you into information, so you don't contradict yourself. I don't know if I would go too much into like a major therapy, REMX or some remedial exercise or something. Just go with the flow and give them like a brief kind of lifestyle. So it adds to complexity of your treatment, but it doesn't sort of expose you to like, oh, he or she doesn't know what they're talking about. Right? So yeah, like kind of like something like this, please monitor your emotions, avoid the stressors if that's the major cause that's stated in a scenario that it is causing a headache or stuff like that, right? If you're smoking, please, lower the smoking intensity or try to quit if you're drinking or, so you give them some kind of lifestyle advices like toward the self-care, right? Okie dokie. So in terms of it, of the herbology, we're going to quickly go through it because all of you are acupuncturists, but for some of our colleagues, it's online. Okay, so formula for wind, cold, headache is Chuan Cheong Chatiao San. San means powder, and it's administered in the form of decoction. These are the herbs that are in it, and these herbs are so the herbal formula represents the herbal construction that induces, so what it does, it opens the pores, it sweats out the pathogen, and it warms up the body interior. So it's the formula that warms and expels, like diaphoretic formula. For modification, like if you have particular like invasion of the cold involving, for example, Juyin meridian, so it's the vertex one, and it's followed by retching, salivation. We can add, for example, Evodia, Wujuyu, and we can add Pinellia that is prepared. And for filling of the phlegm attacking your head, so the head is tightly wrapped, you have heavy sensation of the limbs. We add Duho, Angelica. We add Astrodiolus and Xanthium. Which are known to downgrade phlegm to dampness, and then it's diuretically expelled from the body. So with the wind heat headache, we have a antipyretic formula that's cooling down the body, and it's also sweating out the body, so it's expelling the pathogen as well. So the formula here that we have is Cheong Ji Xiang Tang. Tang means soup or decoction, right? And for modification, if you have constipation, which means when the pathogen attacks the lung, it usually attacks the junior partner organic systems, in this case, large intestine. So we usually see if they're sweating a lot because it's a wind heat, they will become dehydrated. And dehydration may affect their surfactant coating inside colonic wall. So it may cause actually loss of lubrication that may cause a constipation. So in this case, we may add Jiduhang, which is prepared, just to induce more of the motility and more lubrication in a colonic wall. With the wind dam headache, so we have a formula that downgrades the sort of dampness, and it's a diuretic formula. So it pushes us to urinate so that we avoid more, and induces a bit of a kidney action. So problem with this formula is you cannot give them a large dose, or you can have not kidney failure, but you can overwhelm the kidneys. So the formula name is Changhua Shengti Xing Tang, so it's a decoction as well. And to modify it, if you have dampness not just in upper jaw to define is above the diaphragm, middle jaw is between diaphragm, and slightly so sort of a line that goes across ASIS, anterior superior iliac spine, so below the umbilicus, that's the middle jaw, and then the lower jaw is like basically pelvic floor and the legs, right? So if we have retention of the dampness in the middle chamber, middle jaw, middle energizer, that actually causes a chest suppression, loss of appetite, diarrhea, possible emotional depression. We add Changju, and we add Chen Pi, which is the immature orange skin that's dried, and what it does, it disperses the moisture dampness in the middle jaw. For anti-nausea and vomiting, we add ginger, and we add Pinellia and agastiche, right? So for the hyperactivity of liver young, it's modified Tianma Goteng Yin. So it's a Gastrodia and Unicaria decoction, or Urticaria decoction actually. We modified this one for if the hyperactivity is due to deficiency of liver and kidney. And so remember that what I mentioned, there are two. There's one when liver yang is actually not pathogenic. It's being floated up because the liver yin and kidney yin is not holding it down. So it's kind of like that empty heat kind of business, right? Where both are at the same time, and then one just drops, so now the other one that's normal looks excess, but it's not really excess. So this is what we call a false heat, right? So in this case, we would add certain herbs here, right? So we'd add Rehmannia, we would add Multiflori, Heshovu, and Lingustrum, Fructus lucia, Gojutsu, and Eclipta herb. So we're dealing with empty heat, right? Headache due to kidney deficiency. So this is usually kidney yin deficiency. So formula here is, it's like typo, Dabu Yin Jian, right? And it's the formula that tonifies the kidney yin. If the kidney yang, which is a milder pathology, is there, in addition of kidney yin, we would add some herbs. So we would add aconite, that it's accessory aconite root, not the main root. So it's not strong as a main root. We would add the cinnamon, and I don't know if we would add ma huang because it's not allowed in Canada right now. So that's a federal, right? So, but we would probably add shufu juzi, so it's a prepared aconite as well. So all this, and shinshin, all these herbs are sort of spicy, hot, dispersing herbs, right? They kickstart adrenal secretions. So headache to deficiency of the qi in blood, it's a famous Bajan Tang or 8-herb tonifying decoction, and it tonifies both blood and qi, so structure and the function. And if we have additional sweating, shortness of breath, lassitude, and fatigue, we would add astragalus to the formula to it. Headache due to retention of the phlegm. So this is a headache where we have that feeling of being, you know, like congested and squeezed all over the head. We have heavy limbs. Basically, it's a long-term headache, so it's a chronic headache. So formula here that we use is Bancha, Baiju, Tianma Tang. So it's Pinellia, Astrodalis, Macrophylla, and Gastrodia. It's a complex formula, And what it does, it downgrades the phlegm into dampness, then it uses the diuretic effect of the body to void and this and remove the phlegm into dampness and then dampness altogether. This formula cannot be used for too long because it can cause systemic dehydration. So nutritional advice to the patient is important with this formula, so they got to hydrate themselves. Modification here is if you have an extra heat that it's close from the phlegm that obstructs the chi and blood flow, we use the bamboo skin. We use the immature orange fruit, and we use scute, which is huangqin, which is a natural antibiotic to cool down and purify pH of the blood. Headache to blood stasis due to so this could be a local trauma, closed head injury, whiplash, or long-term blood insufficiency, vascular insufficiency, right? So Tong Xiao Chan Huo Shuo Tang, decoction for activating blood circulation that vasodilates blood vessels and thins the blood at the same time is used. And if this is followed with severe stabbing, headache, and at this point I don't think we can add this because Scorpio and Scolopendra are a Schedule B herbs for British Columbia, only allowed to be used by doctors of TCM. In Ontario, we still don't have a regulation, so as far as I know, we're not allowed to use these ones because they're toxic substances of animal origin. Thank you. Thank you, Ms. Break. I'm going to rest my voice, and you get to rest too, and we'll continue. Thank you so much. So welcome back. Someone asked me to write my name. So what I'll do is, did you guys copy this? Can I remove it? So my first and last name, Zoran Jelicic. Okay. So we're gonna tackle toothache. In Chinese medicine, we see toothache as usually predominantly caused by rebellious stomach qi moving up. So basically, the stomach qi should go in normal functions down, should move the churned food into small intestine and so on. But occasionally, we'll have something like we call in Western medicine gastroesophageal reflux disorder, right? So GERD and acid, either through hiatal hernia or inferior esophageal sphincter, splashes up in esophagus and goes up and causes the rapid change of the epithelial tissue, and then later on gums and everything. So we have inflamed gums, gingivitis in long term, and so on and so on. So in TCM, we see the stomach as a major pathogenic organic system that causes this kind of disorder. But there are other, of course, issues as well. Right? So the major points that we use, and you'll notice again, there's approach of near and far, or systemic and local point. So there's a hugu, which is large intestine 4, right? That's used to lateral representation of the body, and generally it's used contralateral. So if I have a pain, let's say on the lower, tooth, and it's a root canal, for example, I would use in a clinical approach contralateral approach, like I would use it from left large intestine 4. That doesn't mean you can't use both. You can, right? And then we would use the two local points, stomach 6, stomach 7, right, on the face over the area, so near and far kind of approach. So this is a basic formula, right? Naturally, then we can add other things like stomach 44, another systemic point down there, like distal, right? And then oops, did I? One sec. Yeah. Okay. So where's our 1, 2, and 3? Sorry, I'm just trying to look for first 3. Okay, thank you. Okay, so we're missing the page just before this one. So the first syndrome that we're covering is toothache due to stomach fire. So basically, rebellious stomach acid and stomach chi moving up. The second one is liver fire invading the stomach, so liver offloading on the stomach. The third one is toxic heat, and in this case, the toxic heat also building in the stomach and esophagus. The fourth one is stomach yin deficiency with the heat. The fifth one is kidney. Kidney yin deficiency. The sixth one is qi and blood deficiency. Seven is heart, blood, and spleen qi deficiency, and then blood stagnation. So, if we look, there's almost even number of excess and deficient conditions. So, stomach fire excess, liver fire invading stomach excess, toxic heat excess, stomach yin deficiency, kidney yin deficiency, excess. Right. So 1, 2, 3, 4, 4 deficiencies and 4 excess conditions. So it's almost like an even, right? Excess conditions tend to be more acute, and deficient one, they tend to have acute episodes, so acute presentation, but they're generally more chronic in duration. So we're really talking the timeline here. Pure acute is, as we know, first few days. Acute episode of a chronic could be anywhere on a line of chronic, which is, past few weeks and on. So the strength of excess condition generally produces stronger pain in presentation, which may show up in a scenario that you guys will see it. So basically, toothache is a feeling of the pain in the teeth and surrounding area for various reasons, and can be triggered or aggravated by external things like such as cold, hot, as well as internal things like acidic and sweet foods. Can affect not just the tooth but gums around. So we can have things like dental caries, periodontal diseases, gingivitis, and hypersensitive tooth, right? Toothache is closely related to hand and foot Yang-Ming channels, as well as a kidney channel. The hand and foot Yang-Ming channels go into the lower and upper gums, respectively. So when we say Yang-Ming, which channels we're talking about? Stomach and large intestine, yes, hand, foot, and so. And if you look at the representation, it's there. They either begin or finish into the jaw or that part of the face where we have a direct access to the tooth, right? So these toothache can be due to flaring up along the channels due to the pathogenic fire. So it means some kind of strong inflammatory response in a tissue that eventually makes it from the trunk into the oral cavity, right? And this goes alongside of the either large intestine or stomach intestine channels, but it could be followed by some other associated channels as well. But in majority of the cases, it's a large intestine and stomach intestine, so hand and foot Yang-Ming channel. There are some deficiency symptoms, as we mentioned, particularly with the kidney yin, kidney being in TCM theory as a root of the all yin of the body, or all the fluid production in the body. Therefore, it's a lower source of the fluids in the lower jaw, and then we have spleen as a sort of transformation, transportation pivot, and then the lung as distribution from the upper jaw, right? So sometimes toothache can be due to ongoing dental caries causing by overeating sour, sweet food and poor dental hygiene, right? In terms of identification of the patterns, chief symptom is obviously pain in the gums and in and around the tooth, and the first one is the stomach fire that's moving upward, and generally it's manifested as a severe toothache with the full breath, so thirst, constipation, and pulse that's fast and surging. So the pulse is literally like hitting your fingertips, like when you're touching it, even lightly on a pulse, right? So pattern of the toothache caused by wind fire manifests as an acute version of the toothache with gingival swelling around, redness, may be accompanied by chills and fevers and floating rapid pulse. So that's basically, it looks like upper respiratory disorder that also you have a dental condition going on concurrently with it, right? The pattern of toothache caused by deficiency of the kidney in is accompanied by intermittent dull pain, usually no higher than 5 roughly on a scale, numeric pain rating scale. May cause a loose tooth, and there's an absence of full breath. So there's less of that acid kind of movement up there. Generally, we may have like a pale red to red tongue, very almost no coating, and the pulse is usually a bit deeper and tready. So primary treatment, as we mentioned, it is near and far, systemic far, and the local 6 and 7 near, right? Supplement points are, in the case of the wind fire, we are the Sanjiao 5 and gallbladder 20. In the case of the stomach fire, we add stomach 44 and large intestine 2, Urgen. And in the case of the kidney deficiency, we add the Yuan source point, kidney 3, and liver 2. So these would be like to combine it together with a basic formula. I can address this talking through it. If you want, you can take a notes which points we would add. Yeah, no problem. So so let me just finish everything, then I'll go back to the beginning and then we'll address this. So that we have a flow. Otherwise, we're gonna run like in the time, like really behind. Okay, but yeah, just remind me, please. Okay, so here so we mentioned the primary treatment, and explanation here is that the hugu is a distal point and it's used to disperse the, so it's basically an anti-inflammatory point that controls the side of the face. It's used more effectively, it's used when it's used contralateral. So if it's almost like, a stroke, the contrawiring of the brain. So if you have a problem on the left side dental pain, upper or lower gums, you would use the right large intestine 4. This doesn't mean you cannot use both, right? I'm just saying that it's more effective if you use the opposite side, but you can supplement with the other side. Stomach 6 and 7 are local points that tend to reduce the swelling, increase the circulation of the blood and qi, bring more oxygen and nutrients into the area, and alleviate the pain. I would go that far to say that they probably cannot reduce the pain to 0, but they can significantly reduce the pain, right? Auricular means to treat would be points on the ear, and microsystem difference between the body system, regular points, and microsystem is in the way the microsystems work. So microsystems generally work rapidly, 2 to 3 times faster than the body system, but they don't last too long. So when we need a rapid relief, we usually go to microsystems such as scalp, ear, hand, abdominal area, wrist and ankle, and we can induce much faster physiological reaction for whatever symptoms and signs we're like targeting. But unfortunately, the length of the benefits that we're getting or the physiological influence is usually hours. That's it. So we generally therapeutically use these microsystems to open up the body, reduce the pain, reduce the swelling, stabilize the patient, and then maybe we go with the body system. So it's overlapping. Just a comment on this. So yeah, so these areas would be used: upper jaw, lower jaw, Shen Men, so it's triangle fossa 4, upper tragic, apex, and we can use the needles. Generally, we use needles, not seeds. It's an intra-office procedure because seeds work slower. And in this case, if they come with a rapid pain, and I'm assuming, most of you felt it, what tooth pain feels like. So you want to relieve like yesterday. So that's why we tend to use needling in the ear and not so much seeds. But we could send them home with the seeds as a self-care to sort of as a form of self-care pain management. In general, acupuncture and moxibustion therapy is used in the treatment, and it can reduce and produce temporary pain relief. In my opinion, herbs are also needed for prolonged treatment of the pain. So we're going to just cover the basic formulas that we use. So for first one is Ching Wei San. It's a clear to stomach powder, and it's used when we have lots of stomach heat that's raising up. It's a mild antibiotic formula of general spectrum that controls the hydrochloric acid content and helps to close lower esophageal sphincter, so there's not much acid reflux going up. It comes in a decoction, comes in a tablets, it can comes in a pills. It's the most effective when it's taken as a decoction, the way our GI system works, because absorption rate. So the Chinese say that lots of herbs here are cold and bitter, such as huanglian, and they have antibiotic properties. They also tend to change the pH of the blood. The Chinese call cooling the blood, disperse the stagnant blood, so thinning the blood effect. In that case, Rehmannia Shendi is used to change the pH of the blood from acidic to alkaline, and then Dangui or Angelica is used to thin the blood. Other herbs who are pungent and sweet are regulating the plasma part of a blood as well. With more acute presentation of severe redness and swelling of the gums, we can add some other herbs. So verbena, pugongjing, which is dandelion, cornus herb, fructus arhi, which is a very cooling herb, nushi, which is sometimes called ox knee herb, gardenia, rubia, and these herbs are partially circulatory and partially cooling to reduce the hyperacidity in the stomach. So with the liver fire invading the stomach, we use Longdan She Gantang, also antibiotic formula, that regulates how the liver is purifying the blood. So major problem here is fatty liver disease, where the liver cannot purify the pH of the blood properly, and this formula is used usually short term for about 10 days, and it can significantly detox the liver hepatic cells, which in turn helps to buffer the proper pH of the blood, and therefore reduce any hydrochloric acid hyperacidity, because the liver actually through via hepatic network supplies the raw material for hydrochloric acid, which is the blood. If the blood is improper pH, then the acid becomes too acidic, hyperacidic. Right? Yes. Actual liver enzyme changes when you take that? Yes. Yeah, there's research done in University of Tübingen in Germany that looked into a number of these formulas. They all come from one smaller formula called Sun, frigid extremities decoction. It's from Zhang Zongjing book from 1900 years ago. It's a very famous formula. So Longdan Shen Gantang, Chai Hu Shu Gantang, Shao Yao San, the most famous formula in Chinese medicine. They all come from this tiny formula, and they all work by increasing bicarbonate ions, regulating liver enzymes, regulating pH, and reducing the liver in its size, actually, over the longer period of time. Right? So basically, they're anti-hepatotoxic medications. So liver actually benefits from them. Problem is patent. Big Pharma still doesn't own the patents, so the research is kept down. Research that proves that this decoction doesn't just work on the liver itself, but it works like overall later on a pH of the tissue, particularly the way the stomach acid is formed, hydrochloric acid, and the coating inside the stomach wall. as well, what we call in Chinese medicine stomach yin, right? That surfactant coating that protects the stomach wall from hydrochloric acid. So so let me just go to the part where we modify it. Well, we got to see what kind of herb-drug interaction we would have here, and maybe we should avoid it. So take it, this herbal medications about 2 hours apart from any other biomedical synthetic medication. So you actually want to avoid interaction between herbs and synthetic medication, because even at best, herb-drug interaction is not very well researched yet. There's no interest in it, guys, because as long the big pharma does not hold patents for herbs, they don't care much for them, right? So there's no funding for this. So in a clinical setting, we usually, if you prescribe herbs, we prescribe them 2 hours apart. Okay. So the next formula will address the toxic heat, and this is a strong antibiotic decoction. So Huanglian Jiudu Tang, so Coptis and Scute. It's used for a number of other issues in the body, but in this case, it's used for severe toxic heat in the middle jaw, particularly stomach, and it's a sort of like a secondary infection due to certain viral infection of the stomach. That then causes the hyperacidity and movement of acid up the esophagus and affects the oral cavity, right? So it's such acute that we start having gum bleedings, ulcers. There may be other orifices bleedings at this point. So if the patient is stable and they don't need the life support and they come in our clinic, we can treat them with this formula. If they need obviously more life support and a stronger sort of like a multi-team treatment, then we usually refer them to the hospital. So generally patients will present as bleeding from nose, sclera, and skin, but I wouldn't go far saying these people have Ebola or hemorrhagic fever. Obviously, we wouldn't treat them with this. They have severe constipation that is alternate, have bouts of diarrhea, yellow, orange, or yellow urine that's smelly and low in input, red tongue with yellow coating, forceful and rapid pulse. Pulse sometimes feels hollow, like empty. This formula is usually administered 3 to 6 days, short term, in large quantity based on a sex, stage of the condition, so male, female will be different, and weight ratio. In addition, it could be modified, so indigo or Qing Dai is added to it, and then of course the 3 yellows, the 3 strong cooling and antibiotic herbs, Huanglian, Huangqin, and Huangbai are added as well through it. In the case of damp heat and toxic heat in all jaws, so systemic, Rehmannia is added to cool and nourish and distribute the fluids through the body. Tsebaye and OEJ, which is herbs that are like hemostatic, are added to stop the bleeding. And again, indigo is added to cool the liver and clear the toxic heat. Okay, so I believe so. I'm just looking to see. Yeah, so this is a summary of it. So yep. Yeah, so so in the case of the toxic heat, we have a combination of the systemic point, around 12, which is frontal point of the stomach, so it lies right over the stomach, right? You do have it in the bottom of 18 page. Yeah, sorry. Yeah, thank you for pointing. We have a systemic point of stomach 44, and it's combined with the large intestine 4, Sanjiao 2, Laogong PC 8, large intestine 11, and then local points of stomach 6 and stomach 7. Supplementary points are with the swelling, you add Sanjiao 20, small intestine 8. With the severe pain, you add large intestine 2, small intestine 5. With severe heat causing a bleeding, you add stomach 42. With ongoing constipation, we add Sanjiao 6, stomach 25, which is the front move point of a large intestine. With ongoing liver fire or a liver toxicity, we add the liver 2. Ear points as an extra system. We would treat points for stomach, mouth, tragus, apex would be bled, upper jaw is treated, lower jaw is treated, and Shenmin point is treated. If we have a toxic heat, we would just see here. Why is okay? Why is toxic heat? Okay. So it's on page. Sorry, just find it. Okay, so on that's it. Actually, I don't have. Yeah, that's it. Yeah, sorry. Okay, stomach-in deficiency with the heat. So this is a deficient condition. Eunugian jade woman decoction is added to regulate hydrochloric acid. It's a milder, like anti-acid formula that's added. If condition becomes more acute with the bleeding gums, we would substitute Rehmannia. Regular Rehmannia for the prepared Rehmannia. We would also add Imperata and Rubia, as well with Motan, right? If the condition is followed by severe thirst and dryness and systemic dehydration, we would add Trichosantis, and we would add Shihu herbs as well. With the mild stage of blood stagnation around the face, we add Taoren, which is and Honghua. So Cartamus and sorry, my brain just stopped. It's almond seed sliced. If okay, sorry. With the kidney deficiency, we use very famous Rehmannia 6, former Li Wei Di Huang, which is a major kidney and liver yin tonic, but mostly kidney yin tonic. So it's a formula that was originally pediatric, but it was adapted and modified for the adults with the dosing. It's administered through decoction. That's the most effective version. It could be administered through tablets and the pills. With the qi and blood deficiency, we would use Bajentang, ginseng, and dangui 8-herb combination. It's a very known qi and blood tonic that evenly tonifies both qi and the blood of the body. It could be augmented. So we could add the skin of that is cooked off the what do you call it? Donkey skin. So jiao, and it's the gel that it's extracted. This is a human carbonized hair, Crinis carbonatus hominis. with the sign of the yang deficiency, cold and prominent spleen qi deficiency that follows through loose stools, poor appetite, cold intolerance, and the systemic bruising, we would add honey fried astragalus in a significant dose. Heart and blood spleen qi deficiency, so which is followed by insomnia, palpitation, general anxiety. Basically, our formula will follow through doing gui pi tang, ginseng, and longan combination to strengthen the heart, blood, and spleen qi deficiency. So it's a combined qi and blood deficiency. Gui pi tang is a very known formula that's used as a blood and qi tonic, same as bajian tang. With the blood stagnation, we would use very famous Astrodius and Percy combination, or sometimes called blood mention formula. It works in upper jaw. It's a major blood thinner. It's used in cardiovascular and generally ENT conditions when we need to thin the blood and use anti-inflammatory action. It comes from Zhu Yu Tang family, where the cousin is Shao Fu Zhu Yu Tang and Shu Fu Zhu. The Shao Fu Zhu Tang is used for lower jaw for menstrual problems. Shu Fu Zhu Tang is used for upper jaw, respiratory, cardiac, and ENT conditions. It can be augmented where we add Jianceogan, rubia. We add Ruxiang, which is the frankincense, Moya or myrrh, Yanhuso cordialis for the pain. If you have ongoing heat in the liver, we add curcuma. With deficiency and the cold, we add Chaihu bupleurum, G-gen, and aconite, which can be followed with some other dispersing and hot herbs such as cinnamon bark, epididymis, and Morinda officinalis. With the ongoing yin deficiency, we would remove the Chaihu, Jiugan, Chuanxiong, and Zhike, and we would replace them with the Mai Mendong, which is major yin tonic, Yuzhu, Nujianzi, so Fructus angostri, Eucalyptum. We would add Radix, so we would add Rehmannia, it's a raw, with the blood deficiency, and Gojutzer, which is, anyone knows what Gojutzer is? You know, those little red kind of things that you drink in your bullberries, yeah. It's a very famous sort of like a blood tonic and chi tonic. You know, lots of manufacturers put it in a tea. And we add also Hershewu, which is a polygonal multiflora, which is a major blood and chi tonic. So we're continuing with the regional pain syndrome. So we had a toothache, and now we're going to earache. So basically ENT in a sense, right? So the principal points are here, a local points. So we have gallbladder 2 and Sanjiao 17. There are okay, no problem. Thank you. So this is the first page. Okay, so we have a principal points, local, and we have a systemic points which are distal, right? So we have Sanjiao 17, gallbladder 2, distal points, gallbladder 43, and Sanjiao 3. And then we have syndromes laid down for you, right? So we have a syndrome of the wind and heat attacking exterior, attacking from exterior, sorry. So exterior pathogens of the wind and heat attacking the head, right? So in that case, we add Sanjiao 5, we add gallbladder 20, we add large intestine 4, and the major formula is Yin Chao, Jiadu Pian, so which is major upper respiratory condition. This is basically our upper respiratory condition, flu or cold that is causing secondary ear infection. or maybe there was an infection there, but it's accentuated by the respiratory, acute respiratory or viral invasion, right? So second one is syndrome of fire and heat of the liver and gallbladder raising up. So in that case, we add the liver 3, so systemic point distal, gallbladder 40, and we use modified Longdang Shen Gantang decoction. Third syndrome is hyperactivity of the liver fire due to the liver yin deficiency. So we would add the Bakshu points for the kidney, bladder 23, Bakshu point for the liver, bladder 18, Yuan source point for the kidney, original point kidney 3. And we would use the modified Jibai Di Huang pill, which comes from that Rehmannia 6 formula, which is Liwei Di Huang. So this is Jibai Di Huang pill. Tong, earache. Commonly seen symptom of many ear conditions. Syndrome differentiation of the ear pain basically is differentiated according to severity of the pain and subjective presentation to the patient that is reported to us, because we can't tell how much pain they have. I mean, we can observe them, but they can tell us on a, I guess, given scale how they feel, and they can also report secondary symptoms. So usually we had things reported like modified Meniere presentation, so vertigo, tinnitus or tinnitus, inability to swallow, postural dizziness, and so on and so on. So one of the major physiological or pathological mechanism here is a loss of nourishment that meridians bring to the ear region, and it stems from inability of spleen and kidney to move blood and qi up there, and therefore there's some kind of obstruction of the ear region due to things like vascular insufficiency, that we see it as a blood stasis, inflammatory condition somewhere else in the body that raises into the head, so fire and heat of the liver and gallbladder, and severe earache can basically completely immobilize the client. Primary otalgia or primary ear pain is, fairly common. I guess depends what kind of clinic you own. If you're in ENT or neurology-based practice, you may see it a lot or not. So we have pain that it's reported in auricular area around external auditory channel, pain deeper in the drum membrane or the middle ear. I must add, most of the people cannot differentiate this. This is a very medical term that we're comfortable with, and we may be recognized. Patient will not describe you like that, right? Patient. So on your exam, they may use this medical term. They may also use lay term. Patient comes to your clinic and reports that he or she has a pain in a right ear that feels deep. He affects them in terms of how they can walk or stand, and the pain is either local or irradiates somewhere. I'm assuming they may describe this scenario like that. Maybe not medically like this. For pediatrics, yeah, we see lots of earache in children, yes. Very similar. The major difference between pediatric population and adult population, how we treat it, is that Chinese see children as rich in what we call yang qi, because they need this yang qi, a higher metabolic rate than the adults, to grow, right? So therefore, acuteness of ear pain in the children is subjectively described by parents and children as higher than in adults, because of this higher metabolic rate in children versus adults. So therefore, emergency, like a kind of presentation of the children with the pain it seems more urgent than when an adult comes in, because you have two patients. You have a child and you have a disturbed parent. So you may not treat the parent, or you may through the wards and counseling, but you technically earn two patients there. With the adult, you have only one, And while it may be acute pain, it never has sense of urgency as with the children, I would maybe add. So there are extra points added to children when we treat to address this extra urgency. That's the major difference between adult and a child, right? And children metabolic rate, especially in herbs, which you may not be interested right now, is explored by the clinician because children respond, metabolize to herbal decoctions or tablets much faster than adults. So the more aggressive dose, but more often are administered. So we may administer every 15 to 20 minutes a dose while under our supervision to bring the pain down. While with the adult is generally very sort of once or 3 or 5 times a day, we'll let them go home with the medication. With the child, we actually keep the child in observation as we administer stuff. So that's a major difference in treating children versus adults. Right. And interference from parents, of course. Nerve-based or stress-based. So it could be two versions of this nervous otalgia, as they put it. So it could be stress-based, it could be neurology-based, where the emotions don't play as much role or they're not surface-like. Stress-based otalgia or ear pain is obviously stress-induced, and once the stressors are down, the pain is decreasing. Neurology-based, so the B version, where the central and peripheral nervous system presentation shows may or may not be induced by stressors to the degree. Either way, patients will report usually 6 and higher on a scale of 10 severe, possibly transient pain. May represent some of the dysfunctions of the peripheral nervous system, such as paresthesia, numbness, that it's interplay with burning sensation, electric shock or electric transition, like a pain that it feels like splitting or tearing of the tissue or the part of the head around, and it's vascularly fed. So basically, the stronger circulation, the lower the pain, the less of the more vascular starvation, the stronger the pain, interspersed with numbness and paresthesia. So the disease is mainly caused by pathological change affecting trigeminal nerve and some other nerves around it. In a case of tympanic membrane inflammation, we're looking into tympanic neuralgia as well. It could be occupational driven, where people are exposed to ongoing to high decibel sound that can actually induce this kind of condition as well. So it could be recurrent. Reflex ear pain involves the division of trigeminal nerve, glossopharyngeal nerve. Pathological changes depends on nerve branch distribution. Pathological changes can be manifested like inflammation of the different membrane of the ear and surrounding areas, such as sinus ethmoid and other splenoid sinus cavities. It can be manifested as other oral cavity changes, such as the trash or dryness in oral cavity, dental pain like that we covered, so it can mimic the root canal inflammation. It could be root canal inflammation, sometimes concurrently with it, so because of the closeness of the structure. In terms of it, other structure, it could induce things like tonsillitis or larynx or pharynx inflammation as well, aphasia, dysphagia, aphonia, loss of the voice as well. It may play into TMJ, like mechanical syndromes, where we have an issue with opening and closing of temporomandibular joint as well. Main points for marked diagnosis. So ear pain is marked in increase and worsens when the patient is using when the patient is chewing or the ear is manipulated in some way or it's laid on it or pressed by the phone. So any contact in the ear may increase the pain. External auditory channel may be discolored from red to purple to some and then may have some discharge secretion wise. Patient may or may not have feverish sensation. When they do have it, it runs pretty high for generally, and it's transient. Patient may or may not have a aversion to the cold, and they're generally dehydrated. Once they ingest more than, I would say, half a liter of water, it may cause a vomiting as well. There may be some lab examination that they may come with it. We don't have access to these, but in the case they do bring it, you may see some immunomodulating physiological responses in terms of elevated immunocytes like white blood cells, neutrophils, and others. They may take a bacterial culture through urine, saliva, and the fecal. They may take also, if they have purulent secretion, culture and check for the bacterial or viral infection as well. So the skin around or the skin of the ear itself may change. It may thicken, it may thin, it may change the color, it may form some of the squamous crust around it. Occasionally, in addition of purulent fluids, may bleed if tympanic membrane is ruptured, and that's the case when we have like release of it, and that marks usually decrease in the pain, right, and loss of the hearing. So if that happens, that the patient comes and through the treatment reports the pain was higher, and then you can observe that there's a pus and blood coming out of the ear, and they report that they can't hear you anymore, but the pain is decreased. You may want to send them to emergency department so they can take a sample and then see. And if you problem is, lots of practitioners, if they have otoscope, they're going to stick their otoscope in it. This is not to be done because you need to have a really sterile instrument, and now you contaminated your instrument as well, despite that little plasticky kind of thing on it. So I usually suggest we send them to the hospital so they can, examine them better, and then they may administer ear wash or any other otoscopic therapeutic intervention. Right? So clinically, these conditions can be as an external invasion of the what's it called, the pathogens carried usually by the wind. So in this case, wind heat. Could be internal conditions such as fire and heat of fire in a gallbladder, hyperactivity, fire in the liver due to liver iron deficiency. At acute stage, treatment generally focuses on reducing the heat, purging the fire, if indeed is the hyperactive liver fire due to iron deficiency, or damp heat in the liver or gallbladder. So we're trying to remove the wind. So basically, wind here stands for hyperneurological activity, right, around the area. So you want to bring the sympathetic division of peripheral nervous system under control through needling or possibly through administration of the herbal medication, right? And a secondary or at chronic stage, we focus on tonifying the yin or hydration of the tissue surrounding around and removal of any low-grade inflammatory heat in the area. So syndrome of the wind heat attacking exterior. So this is your typical viral bacterial infection that attacks the upper orifices or upper apertures of the upper respiratory system. So we have typical kind of flu or influenza kind of presentation. Red and swollen throat, fever, maybe sweating, sore throat, and then of course more specific things to the ear. Um, um, Pain in external auditory channel or inside, swelling around the area, maybe some purulent secretion in or around the area. The tongue is usually seen, could be white, could be pale red to red, could have some white coating or without it. Depends how strong his wind heat is. And the pulse is generally floating, fast, and rapid. So therapeutic methods here are to deal with viral or bacterial infection that we see it as a wind heat. So we would clear away the heat, relieve the swelling, and reduce the pain. Medication here that we use is very famous yin chow tongue or yin chow sun, like powder or decoction. So it's lonicera and forsythia formula. It's used for inflammatory form of upper respiratory condition. It's usually viral. It's what we call wind heat. This formula can be modified. We can add prune pit powder. We can add sclutaria in a case of the severe pain, and these are vasodilating and pain relieving substances. If we have any purulent exudate, we can add sophora, which is the antibiotic in action. Syndrome of fire and heat from a liver and gallbladder. This is your wood family of the systemic visceral organs. So main symptoms here and signs are diffuse red swelling and severe pain in and around external auditory channel with pyrexic feverish body, thirst, dry stool with possible constipation. Tongue is red with usually thin yellowish fur or no coat at all. Pulse is usually tight, superficial, and rapid. So major intervention here is to clear away the basically infection and inflammatory heat that is felt in and around the ear. Longdang Shegantan decoction that its antibiotic is administered. If there's more exudates like profuse pus, we add mantis eggs, chuan qian jiang. We add zhao qiao zi, adenophora, nanshan shen, and mai men dong. And these are drying and moisturizing herbs and mildly antibiotic. Syndrome of hyperactive fire in liver fire, obviously, due to the liver yin deficiency and possibly kidney yin deficiency. So kidney is the mother of the liver. So there's a dominancy of visceral organic systems where the kidneys have a dominancy over the, so kidneys represent the urogenital system, has a neuroendocrine dominancy in terms of nerve and hormonal input over the liver, which represents peripheral nerve division of parasympathetic and sympathetic peripheral nervous system. So this is based in a liver fire hyperactivity moving upward due to liver yin deficiency. So main symptoms, in addition of local, systemic, are itching and uncomfortable external auditory channel with some kind of pus secretion and the pain. Red tongue with thin, usually it's grayish or yellowish fur. Pulse is steady and rapid and superficial. Generally, we would administer moisturizing formula that it's also anti-inflammatory, clearing away the heat and it's partially diuretic to induce more voiding and urination. So Ji Bai Di Huang 1 is used, which is a cousin of Rehmannia 6 of Li Wei Di Huang. So it's a formula that has three triple action: moisturizing, antibiotic, in terms of antipyretic, and reduces the swelling or edema. Can be modified if there is more pruritus and itching around the area. We add chrysanthemum, juhua, chantui, which is cicade, armor. And if we have bleeding, we add rubia and jitao to cause blood clotting. So we're coming back to acupuncture treatment that we covered in the beginning now. So we noticed that there's several points here. Some are local and some are systemic. So it's aligned with the general theme that we saw through the book, right? Where you treat near and afar. So we have Yifeng and gallbladder 2 as a local points, and then we have Sanjiao 3 and a gallbladder 43 as a systemic or distal points, right? And the local points here are the points that basically induce the vasodilation of the blood in the area, and they bring more oxygenated blood and nutrients, and they have antipyrexic or anti-inflammatory reaction into the area. So they decrease the pain somewhat, but they cannot reduce the pain altogether, right? So it's a sort of symptomatic treatment to help the patient feel a little more comfortable, and that comfort may be even just allowing us to position them a bit better, right? Because with the ear pain, you'll have a problem positioning patient to, for example, lay down. They'll find even if they lay on the opposite side, it still hurts them. Even if they lay on the back, it hurts them. So lots of them will actually insist that they sit when you treat. And as you know, in here we usually treat people when they're laying down for malpractice problems. We don't want to treat them as they sit, and then if they faint, they impale themselves on needles or something like that. So yeah, so that becomes a problem. So basically what you write is what they put it here, which is the increasing qi and blood circulation, right? And that's a general theme of basically vascularization, so bringing the nutrients. So here qi and blood represents the nutrients and the oxygenated blood, right? So supplementary points here are the distal points of the liver 3, gallbladder 40, and these are points that treat inflammatory condition in actual organ of liver and gallbladder. So this could be gallstones, could be something else going on in the liver at the time. Adding points such as Sanjiao 5, gallbladder 20, and large intestine 4 are used when you have external attacks. So you have some kind of viral or external attack into the upper respiratory region and your sensory things, in this case the ear, right? So he opens the sides of the head and removes the hyperneurological reaction of the body to this viral or bacterial attack, so what we call wind or wind heat, right? Adding bladder 23, bladder 18, the back shoe points of the liver and kidney, and systemic Yuan source point down on your medial malleoli for kidney 3, helps the kidneys process more fluids and moisturize the tissue to the body on systemic level. So we call this tonifying yin to reduce the yin deficiency, and therefore control the hyperactive liver fire, right? So you anchor the liver by processing the fluids more and spreading them through the whole body, including the liver itself, right? So Chinese call this anchoring the liver fire. Alternate methods of treatment. So in terms of auricular acupuncture, we would use the heart, liver, kidney areas, and So the kidneys are up there, heart is there, and liver is there in the ear. So it's your inferior and superior concha. So CO stands for concha, right? Concha 12, 10, and then internal ear, which is a lobule, right? So LO stands for lobule. Subcortex, it's antitragus, right? And we may use embedded needles or filiform needles on it. Other therapeutic treatment, in this case, are some medicated meals. So you can actually use some medicated herbs that could be added to the meals, to the soups, to the dishes. So it's like what we call shiliao, right? Like a Chinese nutritional therapy, right? So these are the examples because they're antibiotic. External therapeutic methods. So this is where we practice the Weick external medicine. So certain substances may be applied around or in a shallow part inside the auditory channel. So we could apply things like Qing Fu powder, which is the basically anti-swelling, anti-edema thing. So I have sort of like what it does, it changes the cartilage and absorption rate around the cartilage of the external auditory opening. Like it draws the moisture in it, almost like a silica powder. In a way, yeah. It's a bit more than just astringent. You could add indigo powder and wash with it, and this is antibacterial topical solution. When you have like sort of some kind of pruritic exudate coming out or pus, it could be you can buy in China. This is usually available in the hospitals. You can buy already prepared topical solution that is done like by using ototic therapeutic in washing the ear, like ear irrigation, right? So these are the things that we may not have access altogether in Canada, but are used topically to assist with the acupuncture and herbs. Do you guys have any questions about the ear pain? So I would say start from the beginning where Professor Wu made it at, sort of like a summarized executive summary, where he adds like 4 basic points and then adds you like 3 to 5 points that go with each syndrome. And if you're obviously interested, you're not so much in herbs, but you can look up the formula that it's there. And that should allow you to rapidly just write the acupuncture formula after you made a diagnosis of the condition and the syndrome, right? Do you need a break or should we push through? Okay, sounds good. Okay, so next one is trigeminal neuralgia and or facial pain, like generalized facial pain. It's a common condition that you may see in your clinic. Principal points are local points. So we have bladder 2, stomach 2, stomach 7, stomach 4, 6, right? So lots of stomach points, 2, 4, 6, 7, and then gallbladder 20 at the back, and then systemic point down at the large intestine 4. Syndromology, or the syndromes present, are invasion of the wind cold, where we, in addition of these points, and we have 6 of them, we add additional points. So Fengmen, bladder 12, lung 7, and we may use the Chuanxiong Cha Diao San or 1 herbal formula. So it's a wind cold invasion. Stomach heat moving up or invading upward. So we add stomach 44 and liver 3, and we use the modified Qingwei Sun formula, or calm the heat in the stomach formula. Hyperpyrexia of the liver, or liver fire invading upward. We add stomach 44 and liver 3, and also we use a modified Qing Gun Sun. So phlegm-based stasis in the channels affecting the head or a face. So most of the young channels either start from the face or they end in the face, right? So in this case, we have a phlegm and stasis that generally it's caused by the spleen, housed in the lung, but affect the head. So the saying is that spleen starts the dampness and phlegm, but it doesn't house it. Lungs are the organ that house the stasis, the phlegm and phlegm stasis and sorry, my brain just stopped, and moisture. So in this case, we picked the spleen 6 that regulates the plasma in the blood, spleen 9 that is not here, and Gushu bladder 17, and we use the Shufu Zhuyutang blood mention formula. Right. So facial pain or facial wind pain or pain of the cheeks in a Chinese medicine, or mian tong, is a condition that it falls sort of in a ENT and neurological division, and it's usually caused by external invasion of the external wind, and occasionally may be caused by internal wind generated in the liver. Right, so neurological hyperactivity. It affects trigeminal nerve and associated divisions of the trigeminal nerve, and through that, patient will report physiological issues with the pain, opening of the jaw, inability to chew, headache associated with that, and other issues. It's commonly seen in a sort of middle to later stage of the age in a patient. It seems like that women reported more than a man. Western medicine calls it trigeminal neuralgia, and generally seen a lot around the mandible insertion here and TMJ joint itself, temporomandibular joint. But it could radiate in remainder of the face through other divisions of the trigeminal nerve. Chinese medicine see this as obstruction of the qi in the blood in the channels due to external invasion of the wind, especially wind and cold, due to internal generation of the heat in the liver that causes hyperactivity of the liver young, which is triggered by emotional and stressful stimuli. Could be caused by deficient liver fire due to the liver yin deficiency, and particularly when in a case when wind cold invades the channels of yang ming, which we know as stomach and large intestine, right? It generally obstructs the delivery of qi and blood, so delivery of the nutrients and the oxygen into the area. Toxicity of the wind heat in this case, so the opposite of the wind cold. So it's a remainder of the viral load of the upper respiratory condition, which is called also latent heat in Chinese medicine. Sometimes you have lots of metabolites that accumulate in the face, and they're not drained by the lymph nodes in the neck and around the jaw, and they tend to cause a milder form of TMJ as well, which is not as often as the wind cold. Any local injury, so trauma to the area, causes the stagnation of first of qi and then the blood, particularly blood stagnation, and can manifest as a facial pain and may be diagnosed as a TMJ as well, especially from contact sports. So, chief symptoms may involve these and some others. So, facial spasming or myofascial spasming, muscular convulsion. Pain is generally described as a stabbing, scorching, splitting, contracting. May be local around the area. May also radiate into the other parts of the face. Down the mandible, may radiate into the eye and into the temporal region of the head. May affect lacrimation or tear production, as in like not much or overproduction. So hyperlacrimation may cause hypersalivation, like increased production of saliva. Um, may cause lots of dental sensitivity. Um, uh, Face may grimace or may be totally flat. Um, um, Cold stimulation may increase the pain, especially in a wind cold case. Chewing may also be one of the aggravating factors. Laying on that side may be aggravating factor. Stressors may be aggravating factor as well. Pain generally may be fixed in a nature, but it could be also moving as well. So the wind cold pattern is generally seen as an invasion of something of the wind cold pattern from outside. As long as there's a cold stimulation of the region, it increases the pain, and it's alleviated by the warmth and topical application. Person presents with a pale red tongue with a white coating. Pulse is floating, it's tight, and on occasion rapid. We may also have pattern of wind heat that we mentioned before, which is usually a reminder of the previous upper respiratory condition that it's not fully resolved. And that one will cause reinflammation of the region, may cause red and bloodshot eyes, increased lacrimation, increased salivation, may present with red tongue with a thin yellow coating or no coating at all. Rapid pulse that it's wiry in nature as well. These presentations are followed by emotional disposition of irritability, short temper, restlessness, and disassociation. So you talk to the person and they don't listen to you. They just, they're somewhere else. A person who presents with hyperactive liver yang due to the liver yang deficiency may present with flushed cheeks, thready, rapid, and forceful pulse, also irritable, thirsty, and reports usually diffuse pain into the area. Pattern of chi and blood stagnation is accompanied usually by chief sign or symptom of stabbing pain. Tongue usually presents as a purplish, and the pulse is usually thready, wiry, and it's felt superficially. It may or may not present with the history of previous trauma externally to the area, right? Treatment. So principal points are bladder 2, stomach 2, stomach 4, stomach 7. I believe we had stomach 6 there as well before stomach 7, large intestine 4, and gallbladder 20. We could add the points. So in a case if you get something added to your case study, such as pain behind the eyes, we can add Sanjiao 23, gallbladder 14, and extra point Yu Yao, right? In a case of upper mandibular pain, we can add small intestine 18, large intestine 20. In a case of lower mandible pain, we will add Ren 24, Sanjiao 17. If we have invasion of the wind cold, we would add additional points to these, such as bladder 12, and lung 7. In a case of wind heat, reminder, we add large intestine 11 and lung 5. In a case of retention of the heat from the liver and the stomach, we would add stomach 44 and liver 3. In a case of syndrome of hyperactive liver young due to liver deficiency, we would add UN source points for the liver, liver 3, and the UN source point for the kidney, kidney 3. And lastly, in a case of the chi and blood stagnation, we would add points of spleen 6 and bladder 17. So this would cover pretty much the major acupuncture protocol for these syndromes, covering trigeminal neuralgia. So explanation follows. The major formula or the base points, such as stomach 2, stomach 4, stomach 6, stomach 7, bladder 2, are local points to relieve the compression of the nerve roots in the face. So basically, we use the term dredging the channels of the face of any obstruction that is there. Systemic and distal point of the large intestine 4, it's the UN source point for the large intestine, and it's a key point to regulate the side of the face, right? And when used with the liver 3, they call jointly 4 gates, and it opens systemic circulation in the whole body. So combined, liver 3 plus large intestine 4 are called 4 gates. It opens systemic circulation in the body. And they work really efficiently to dispel pain due to the contraction of the external pathogen, in this case, the wind. The gallbladder 20 is the point that relaxes suboccipital musculature and contributes to vasodilation and increase blood and chi circulation and removal of the wind in that area, which in turn relieves the pain in that local area. It also has effect from the back to the front. Additionally, points for subcortex, cheek, jaw, forehead, and the Shen Men, which is a major young point in triangular fossa, are selected. Generally, we select about 3 to 5 points in a ear because of the size of the ear. Because you add more, and most of the points will be overlapping. So 3 to 5 would be probably good. And these can be stimulated with the needle or the seeds. Bloodletting and cupping is used around certain points. So we could, especially in the case of chi and blood stagnation, we could use a lancet and prick the points like stomach 4, stomach 6, and small intestine 18. And we would usually then suction and use the negative pressure in a cupping to remove about between 10 and 20 drops of the blood. And this can be repeated if the patient is coming every day, every first few days, if they come every 2-3 days, first few sessions. There is an intradermal needle therapy where the needle is actually affixed inside and taped, or we insert a common, like a pharmaceutically prepared surgical thread that is dissolved by the body. Unfortunately, this is still not within our scope of practice here in Canada. Sorry? Yeah, when I finish. So, trigeminal neuralgia is the sort of tough disease to treat. It is persistent. It's recurrent. It needs more than just a local treatment. In the beginning, focus is on analgesic or pain-relieving aspect. Later on, secondary aspect is functional improvement of the region, better delivery of the oxygen and nutrients to the area, and then treating the root problem as a follow-up. Acupuncture can be very effective in treatment of an analgesic effect on the region, but it needs to be also augmented by the herbal pharmacotherapy. Patients may go through acute and then chronic stage, and there is a spastic stage in between. Lifestyle counseling is important in this condition. So counseling patients on covering themselves, avoiding exposure to draft and cold areas, avoiding eating cold food, chewing like a hard-to-chew food, maybe topically or daily massaging the area is definitely helpful. Prescriptions. So herbal prescription for the wind cold invasion is modified Chuan Xiong Chadiao San or Tang. San is a powder, Tang is a decoction. Liver, stomach heat going up, we use the modified Qingwei San, which is anti-acid and antibiotic formula. Hyperpyrexia of the liver fire, we prescribe modified Qinggang San. Phlegm stasis in channels, particularly Yangming channels. We use, let me just see, where's the formula here? Oops, sorry. Phlegm stasis, it will be Shu Fuzhu Yutang formula for the phlegm stasis in a channel, or blood mansion formula, or Floss and Cartamus formula. Do you guys have any questions about trigeminal neuralgia? So, welcome back. We will talk about epigastric pain. So epigastric area pain. So there are two actually pains in Chinese medicine that we consider. The one is abdominal pain, which is sort of larger pain. And Chinese see abdomen as going from basically xiphoid process to about anterior superior iliac spine. So this area. Here we're talking about very specific epigastric pain right over the stomach, so central part of it, right? So fairly common GI gastrointestinal condition. So in terms of it as syndrome differentiation, the principal points are distal point, stomach 36, that controls contractibility of the stomach wall. The local point, zone 1, REN 12, that lies very close to the actual stomach itself, the organ itself. Another systemic distal point, PC6, that opens the fascial envelope inside the trunk. So it actually allows the fascial envelopes to open. So this combination basically relaxes the stomach wall, regulates motility of the stomach, and relaxes the fascial envelope, especially ligaments that hold the stomach as internal organs. So it's a specific mechanistic reaction in the order that you needle. So we're looking at first syndrome or pattern differentiation category, stagnation of the stomach chi. So stagnation of stomach chi can be caused by pathogenic cold affecting the stomach. We'll go later on in the physiological description of it. So in this case, we would add Wei Shu, which is a back shu bladder point, right, in lower thoracic area. We would add Liang Fu. The next sub-differentiation, so we're still with stagnation of stomach chi. So next sub-differentiation is retention of the food. So basically overeating, right? We would add sorry? Sure, especially after lunch, right? So we can start pressing in addition to these, you can start pressing the REN 10 and then Liang Men, stomach 21. which is a distal point, of course. So so Liang Fu one is the herbal formula, and Bao He one is one of the probably top 10 Chinese herbal formulas prescribed, because it's not only used for food stagnation or overeating, but it's also used to coat the stomach before we administer another herbal medication. So generally, if let's say you tell the person, okay, you should take this herbal medication after meal, and that doesn't work, it still causes contraction, hyperacidity, stomach ache, vomiting, or diarrhea, then we would instead administer this formula half an hour before, and then that primary formula. So this will actually regulate the stomach wall and acidity, and will allow other formula to be metabolized much better. Stagnation, so liver qi stagnation. So I would actually rename this slightly. So it's stagnation of qi, liver, and stomach here, but it would be liver qi stagnation affecting the stomach syndrome. We add Tai Chong, which is one of those four gates. So the liver 3, it's in web space. So the four gates are in web space, right? Large intestine 4 is here, and another web space of the big toe is where the liver 3 is, right? Tai Chong. The formula here we use is Chai Hu Shugan 1, Shugan 1 or Shugan San. It's a very known formula to regulate the liver activity and stomach hyperacidity. Heat accumulation in the liver and the stomach. So originally it's a liver accumulation of the heat that spills in the stomach. So we would add Ren 12, but it's already part of that general formula, so we wouldn't duplicate it, right? And then here, there's a couple herbal decoctions we can use. If the heat is, or fire, if heat turns into the fire, so it's strong hyperacidity, we usually use the white tiger decoction, Bai Hu Tang, right? And then stasis of the blood in the middle jiao, we would add bladder 17, which is a diaphragmal point, and it helps the diaphragm to move more, massaging internal organs, in this case stomach as well. We'd also use Shishao powder combined with the Danshen. In a TCM, absolutely. So for the Gushu itself, it's a so-called blood point. So it moves strongly blood and qi circulation. And this formula, it's called Sudden Smile Shishao powder. When combined with Danshen as extra herb, it powerfully induces the qi and blood circulation in the middle jiao. Insufficiency or weakness of the stomach yin. So we see it as a lack of coating, mucosal coating inside the stomach, which makes the stomach prone for developing ulcer, right? So additional points here would be spleen 6 that regulates the yin-ye. The yin-ye's are two forms of the fluids in Chinese medicine. Yin are clear fluids, ye are thicker, sort of unclear fluids. So examples would be, so yin type of fluids would be like tears in the body. Ye would be synovial fluid inside your joint. It's a thicker one. So in this case, it's the ye one out of the yin-ye. Yes. So the thinner one are yin and ye, the thicker one. And it's this sort of mucosal kind of coating that protects the stomach wall from the hydrochloric acid that it's sort of affected here. And the TCM language terminology is stomach yin deficiency. And in this case, we would pick the spleen 6 and stomach 44 to help with that. And the decoction here would be Yang Wei Tang combined with Shaoyao Gancao decoction. So two together combined, one to regulate hyperacidity, another one to help the body create more of the ye, of the mucosal fluid that protects the gastric wall. Least but not last yang deficiency of the spleen and stomach, or spleen and stomach yang deficiency, if you will. So it's basically a functional dysfunction of both organs, and we regulate this through adding of the back shu points for the stomach. So wei shu. So shu is the point, wei is the Chinese name for the stomach. And the formula we use here is huang qi jianzhong tang, which is the astragalus decoction to improve the spleen and stomach yang deficiency. So stomach ache or epigastric pain is a common condition characterized by recurrent upper abdominal pain that may be local or may be referring. When it's referring, it's sometimes called cardiac pain, epigastric cardiac pain, cardio-abdominal pain, and so on. So one of the tests to show, like lots of times patients or clients come and they were a bit apprehensive because they think they have a heart attack, because they usually have 3 out of 5 most common cardiac attack kind of symptoms, right? So they would come and say, listen, I felt at that point that I'm going to die. And I said, well, what did you felt? And I said, well, I felt someone is sitting on my chest, like there's a pressure in my chest. I was panting, like in terms of breathing, so they were like hyperventilating. So 2, right? And 3, they felt this pain that was referring into the heart area, but really originated in the epigastric area. So they thought, okay, this is it. And so usually what I share with them is I said, listen, there's a little simple test. You just take a glass of water and drink it. And if all those symptoms stop after that, or they lessen by 50%, you do not have a, yeah, of course, you have a version of GERD, gastroesophageal reflux disorder. And I said, if you truly have a numbness and pain going down the left blade of the arm, and it numbs the usually pinky and possibly ring finger, and the pain is actually sort of almost like shish kebabbing or drilling from the left side of the chest under the left scapula, I would dial 911. In addition, if you have these 2 plus the 3, you may have some kind of cardiac issue or heart problem, and I don't think the glass of water will help with that. So lots of times, you know, like you lessen anxiety of the clients saying. So it's a left arm pain interchangeable with paresthesia or numbness that travels at the sort of side, so just on a border between the lateral and medial side of the upper arm and the forearm, and sort of stabbing pain that goes around nipple area on the left side and comes through just at a lower angle of the scapula. Yes. So the pain is going 2 ways, like but here pain is mixed with the numbness. It's not continuously pain. It's a pain and the numbness. Yes. Yes. Also, the secondary division is jaw. Sometimes is lack of vision. Also, in about probably 10% of cases, jaw clenching. Yeah, and of course the hyper respiratory rate, right? Person feels very thirsty after it. They feel metal taste in the mouth from all the acid that goes up. So so that's if it's referable pain. If it's a local pain, then it generally feels like a stabbing pain that's local in the nature, right? We see this as a part of other conditions such as chronic or acute gastritis, peptic ulcer attacks, gastrointestinal neurosis, prolapsed gastric mucosa. Sometimes we see this in as various viruses that may attack the gastric region, right? Like E. coli and so on and so on. So TCM sees this as pathogenic process of invasion of the cold pathogen. So here is external cold that invades you. And Chinese see this through the, they see the reason for this to develop is through wrong dietary lifestyle. So people ingesting a cooling food at the wrong time. So like eating yogurt and ice cream in this kind of weather. right? So it's already cooling food. It's hyperalkalinity food. It coats the stomach, and a lot of times people have need for it. But when combined with sub-zero temperature, your immunity drops down as your temperature drops down, right? So repeated sort of this dietary decisions like this will eventually invade. So cold would invade your middle jaw or your stomach. So you basically you become hypoacidic. Your acid goes down, and it eventually resurges because body sees this as other dysfunctions, and then introduces more blood. It's seen as a raw material for hydrochloric acid, and eventually from hypo you go to hyperacidity, and the pain is eventually the milder pain that feels better with the pressure and the warmth, but later on becomes a stabbing pain. So you go from hypo to hyperacidity if it's not corrected. So irregular food intake, as I mentioned, of the wrong sort of the wrong energetic temperature of the food. So when I see energetic temperature of the food is hypoalkalinized food that will lower the acidity of the stomach. So the food that causes the cooling action inside, not just physically cooling, but energetically cooling. For example, you can eat warm cucumber, and not that you would, but sorry, Alex, I'm just walking too much. But that would still energetically cool you down, even the cucumber was warm. You know. Emotions play a huge role in this, causing a food stagnation, because bouts of anxiety, anger, and depression generally work first in the liver. Liver, in turn, cannot process properly any of the blood to the proper pH, and this blood is shared with the stomach, and we see this as a syndromes of liver invading the stomach, liver heat becomes stomach heat, and so on. So low resistance to stressors is seen as one of precursor of this liver failure, which in turn leads to the stomach or epigastric pain. And then there's a chronic pathophysiology of the deficiency of the spleen and stomach qi that leads later on to spleen and stomach yang deficiency that can cause ultimately a stomach yin pathology. So basically the bottom of all these pathologies is ultimately stomach yin deficiency, which is loss of that mucosal coating in the stomach that causes ongoing epigastric pain, like chronic epigastric pain. So let's look at the excess syndrome. So chief symptoms are abrupt onsets and severe pain, generally 6 and higher on a scale of 10 in epigastric area. It is aggravated by pressure, by heat, and generally it's worst after meal when the stomach is full. So what we have here is chronic overeating that causes acute episode taxing on the stomach. So the stretch reflex inside the stomach is induced and leads us to the food stagnation. Now, when we have a pattern of pathogenic cold invasion, the pain is quite opposite. It's basically alleviated by the warmth and aggravated by the warmth and pressure, and aggravated by the cold. While here, in excess syndrome, we have a pain that's aggravated by the pressure and by the heat. So they're quite opposite reaction to invasion of the cold and food stagnation. So that's a differentiation, right? Pattern of food retention also have this sensation of fullness and distension, and the person is more prone to start belching and passing a wind. So it's a system itself that tries to vent itself because the stretch reflex is induced in the stomach. And the rule, dietary rule, is not just in Chinese medicine ever that we should eat up to 70 or 80% full, and after that we should stop. So basically stop when it's best. So person will also have halitosis with the food stagnation and acid regurgitation, leading possibly to vomiting and feeling better after vomiting, burping, belching, or relieved by passing the gas. Um, Tongue is usually a bit greasier with the food stagnation, and this this stage generally tends to happen toward the later part of a day because of our lifestyle. So we usually come home or we eat later in the day, and our digestive rate is usually slower at that time. So it causes easier for body to have a food stagnation. Um, the pattern or syndrome when we have a liver qi stagnated and attacking the stomach manifests as a pain radiating from epigastric area to hypochondriac area region. We have belching, we have acid regurgitation, desire to sight, like breathe to release like spasmodic pressure in the whole area. We may have some irritability and mood swings from irritable to slowly withdrawn. Um, the tongue usually looks pale, pale red, with sometimes thin or no coating on it. Pulse is generally wiry, superficial, and on a sort of hurried or fast kind of rate. Pattern of the liver qi stagnation and the blood stasis is shown as a local constant stabbing pain in the epigastrial region, and it's aggravated by the pressure and the heat initially, but long-term low-grade heat can actually help. The tongue usually looks purplish with some petechia on it, and the pulse is tready, what we call big and fast, and superficially felt. Yeah, rough is kind of a combination of the sort of big pulse, da, as they call it, and the fast. Deficiency syndrome. So deficiency here is due to deficiency in the spleen and stomach, and of the qi and yang, and the stomach yin deficiency. And chief symptoms are dull pain and epigastric pain, better with the pressure and the heat, and it's usually relieved after moderate eating. So like moderate consumption of food, not like overeating. If you overeat, it will cause then food stagnation. So we'll go from sort of like a dull pain to sharp pain. So pattern of spleen, stomach deficiency, cold. It has a additional specific symptomology of watery regurgitation, loose stools. So not diarrhea, but loose stools. Listlessness and lassitude, so like a sort of tiredness. Decrease local circulation in the hands and the feet. Tongue usually appears pale with thin white coating or see-through coating, and the pulse is usually superficial to mid-level. It's usually weak, and the speed is generally on a slow and a long kind of side. The pattern of stomach yin deficiency is accompanied by dull pain, chronic in nature, with occasional burning sensation, epigastric region, burning with hunger, but generally they can't digest well when they eat, so they generally don't. Even if they feel that they're hungry, they don't eat much. There's a general sense of dry mouth and the throat, the parched feeling that they want to drink all the time. So generally their stools are hard and they may be constipated. Their tongue is red, no coating. There's less of salivation. Pulse is generally weak, thready, and wiry. It could be also rapid occasionally in the first stage. Primary treatment, as we saw before, primary treatment is to start from distal, stomach 36, go local, REN 12, and then go distal again, PC6. Supplement points. So we would add bladder 21, which is a backshoe point of the stomach, with the invasion of the cold to the stomach. We would add REN 10 and stomach 21 to the pattern of a food retention in the stomach. We would add liver 3, where we have a liver qi stagnation invading or attacking the stomach. we would add bladder 17, which is a circulatory point for chi and blood stagnation. When we have such a stage of liver, chi, and blood stagnation, we would add REN 6 and REN 4 combined with the two backshoe points of the one bladder 20 for the spleen, bladder 21 for the stomach, to the pattern of deficiency of cold in both stomach and the spleen. And we would also add spleen 6 and stomach 44 for chronic stomach yin deficiency. So the REN 12 is a central point local that it's used here because it's front move point of the stomach. It's the influential point, and it's used while it's used for stomach, it could be used for spleen and pancreas. Chinese assume when you say spleen and stomach, you're also talking about pancreas. Pancreas is rarely mentioned. It's mentioned only twice in the Ling Shu part of the Huangdi Neijing. So people mistakenly think that Chinese didn't know about pancreas. They did. They just integrated physiologically pancreas with the spleen. So they're only mentioned twice in, like older classics. But it is mentioned later on, from Tang Dynasty to Song Dynasty and on. The major distal point or systemic point for the epigastric pain is stomach 36. While this point is used in most of the conditions in acupuncture as a tonifying point, here it's seen as a sedating point that regulates contraction of the stomach wall. Right? So we would say that stomach 36 in this case is nourishing the chi. It's not tonifying the chi. Nourishing means it's balancing, right? It's not reducing, but it's not tonifying. It's nourishing, right? And it is a lower HERSA point of the stomach, so this is how it actually controls the stomach motility. Now, PC6 is here used as the influential point that regulates the fascial fold and the fascial ligaments that hold the stomach. Particularly so the stomach doesn't get pulled through diaphragmal opening and we don't end up with hiatal hernia. Alternate methods of treatment. So we do use a auricular acupuncture approach. We would use a stomach point, a liver point, spleen point, a Shenmen point in triangular fossa, sympathetic point, and duodenum. We can use it with the needles if the pain is acute, or with the ear pressure through the seats, and they can be sent home with these. They can wear it for 3 to 5 days. It's on a surgical tape. Electroacupuncture is also used as an extra modality where the stomach 36 and stomach 37 are needled, and we would use an electric apparatus and use a dense wave protocol for 10 to 12 minutes interspersively on it. Acupuncture and moxibustion can work really well to decrease and regulate stomach activities, therefore reducing significantly epigastric pain. Careful diagnosis is needed to identify which syndromes we're dealing with so the appropriate treatment protocol can be executed. First line of defense is actually nutritional counseling. So before we administer any passive care modalities such as acupuncture, ear acupuncture, manual like a manipulation or visceral manipulation, electroacupuncture, so moxa, we should counsel the clients what to eat and what not to eat according to the syndrome they're diagnosed. And this can be also repeated after treatment to reinforce the need for patient to observe that they don't do 3 W's, eating the wrong food in wrong quantity and wrong time. So treatment differentiation. So in a sort of early stage, there could be acute or lower acute stage stomachache involves what we call qi hua, or dysfunction in a qi mechanism. And most of these mechanisms are in excess syndrome. Excess syndrome such as invasion of the cold into the stomach, liver qi stagnation or liver fire invading the stomach, and so on. And they easily injure the stomach through reducing the stomach yin and inducing hyperacidity in the stomach. So protracting stagnation of the qi, liver qi, can produce pathogenic heat in the liver that in turn causes the chronic pain involving collaterals that connect the liver and the stomach. In turn, most common pathogenic condition in spleen is usually spleen qi deficiency that could lead to deeper pathology of spleen yang. Once we have spleen qi deficiency, we also are prone to spleen qi sinking, where we have prolapse syndrome. So prolapse of the stomach, prolapse of the pelvic floor, prolapse of the intestines, so hernias in a way, right? So one way to sort of stop the spleen qi from going to qi sinking and yang deficiency, so the deeper pathology is to treat the patients when they're at the qi stage, when it's functional dysfunction. So it doesn't go into structural dysfunction. So qi prolapse, spleen and stomach qi prolapse, and spleen and stomach yang deficiency are seen as not anymore functional problems, but structural problems, because it affects more structure, especially myofascial structure around, omentum, and all the fascial structure that holds the organs. Counseling patients on eating properly, not eating too much cold food at the wrong time of the year, seasonally, having a proper emotional disposition so it doesn't create lots of heat in the liver, maybe self-massaging after a meal or walking after a meal, eating 70% full can prevent significantly a reoccurrence of epigastric pain. Also, paying attention to the relationship between the liver and the stomach and effects of the previous conditions on the liver, such as hepatitis or any other cirrhosis of the liver, fatty liver, and so on. So can actually significantly help us as a clinician to rule out that part or treat the liver before we treat the stomach. So stagnation of the stomach qi, affected by pathogenic cold, intaking of the cold type of a food. So one of the first things that patient notices, in addition of hypoacidity, low acid formation in the stomach, there's a sudden attack of colicky pain, which is better with the warmth and pressure or taking a hot drink. Just so act of taking like a glass of hot water or tea will help hydrochloric acid reconstruct in the stomach and reduce the spasming of the stomach wall, and the pain becomes less colicky and stomach tends to relax a bit. In addition to these, we would have aversion to cold. Chinese would say that our middle jiao is attacked by the cold, so our center of ourselves is attacked by the cold, and then the whole body reacts by sort of shunting the blood and moving blood and qi from extremities into the trunk. So your hands and feet will become colder. Pain will become severe if there's more cold introduced in the middle jiao, either through the food or exposure of the region to it, like maybe not wearing proper clothes and stuff like this. So pathogenic cold attacking middle jiao through eating of the raw and cold food or exposure to the cold can influence the stomach qi or middle jiao qi by inducing stagnation of the qi, deficiency of the spleen and stomach yang qi that is dispersed and causes the colicky pain of the stomach. Warming can remove pathogenic cold and dampness, and warming can be done internally, externally. So it could be something like a hot decoction, herbal decoctions, hot soup, tea or something, plus application of the heat over the large area, followed by manipulation, soft tissue manipulation, through some kind of tuina manipulation. Stagnation of the yang qi generally induces aversion of the cold. So if the pathology progresses from spleen qi and stomach qi deficiency to spleen and stomach yang deficiency, the person will be more averse to the cold. Even a little draft, a little cold will induce the epigastric pain now. So it's seen as a chronic progression of the pathology. And this person will have a strong preference for hot drinks, and generally will have a case of nocturia, like several times urination or more over the night. So therapeutic principle is warming middle jaw, dispelling cold, regulating stomach, and relieving the pain, epigastric pain. Hot application can be done topically over the epigastric region. Spices like a hot ginger or a scallion or onion can be done. Moxibustion can be done either directly or indirectly. TDP lamp can be used over it as well to warm up the area. And then modified liangfu decoction or wan pill can be used for this to expel the cold into the region. So here's an example of one of the nutritional prescription that could be added to the food, right? So we see a number of them are dispersing hot things. So you have fried tangerine peel, this is dispersing and warm, fresh ginger, black pepper, charged triplet. And then poria is the one of the ones that is not hot. It's actually to regulate urination. It's a poria or cocos bread, sometimes called fuling, is a powerful diuretic to remove the cold from the middle jaw through urination. Now we have a retention of the food in the middle jaw and the stomach. So main symptoms are fullness and pain in the stomach, which is relieved after belching or bowel movements or passing a wind. Accompanying symptoms, belching with the fetid odor, like halitosis, distension of the stomach, which is relieved at hunger, and massage after the meal. It's also, there's possibility of vomiting with undigested pieces of the food. Person will also have fecal matter expelled with undigested food with the food stagnation. So one of the diagnostic things is that we see the digestive rate was not properly done, because person will report that they have a loose stool with the food pieces in it. And that's a sign that the food was not properly churned and digested, because the stomach was so full they couldn't do it. There was no churning, right, or mixing. So this person will have a pale tongue that's coated with a thick white coating that has a root. So it's like a piece of yogurt, like someone painted on your tongue. And it will be greasy and really stuck for the tongue. Pulse will be usually what we call large and slippery. So it feels strong when you feel it, and superficial, and slippery feeling feels like the rolls rolling on, like pearls rolling on your fingers. So this is an example of 3 W's, as I mentioned: eating wrong food in wrong quantity at the wrong time, injuring a stomach qi, causing dysfunction of epigastric functions, possibly leading to overweight, sometimes to anorexia if the person induces vomiting from time to time. So retention of the food or overeating is a pretty big problem in our society, because we're a wealthy country. We have lots of food. We can eat a lot, and our friends in States eat even more. If you see American portions with Canadian portions, they eat even more. Generally, it's followed by this white, thick, and greasy coating. So this is one of the main things that you'll notice. So when you look at food stagnation, look for belching. So passing a wind, thick white coating that's sticky, and the person feels generally better after bowels, like bowel movements. So here we administer very famous Bauch 1, or preserve the middle decoction, that it's used to help the stomach not only digest properly but empty the stomach. So this is the major herbal prescription for the overeating. Here we see like what's in the actual prescription. So we have digestive herbs that move digestion, like tangerine and nutgrass, and bunch up in fermented pinelia. We have diuretics like full-length to promote elimination, and forsythia fruit that lubricates the stomach and intestinal wall. Stagnation of the qi in the liver and the stomach. So it's a liver qi stagnation that affects the eventually stomach qi as well. So main symptoms are fullness and pain in the stomach with hypochondrial pain. Sorry. So it's I think misspelled. So it's with the hypochondriac pain involved, right? So we have basically one organ being pathogenic, and it's offloading to another. So in TCM, sometimes we nickname that the liver doing something we call L or loser kind of offloading shape. So if we have abdominal area, right? Here is your stomach, right? And here is your liver. So what happens is liver uses what we call L shape offloading. So it'll move this way to stomach, spleen, and pancreas, and it'll offload up to the lungs and the heart, right? So that's the L shape. So liver basically reduces its own toxicity by releasing in this two directions, so across and up, right? So we're now more interested in this one, where we have liver qi stagnation, and then we have this hepatic parallel network. So when you eat and it comes down esophagus, a sample is moved into the liver to check it for toxicity. This same network has anastomiosis. It shares the blood basically the delivery with between the liver, stomach, and the spleen, which means that some of the blood that it's moved from the liver, especially if the liver is acidic, this blood becomes a raw material for hydrochloric acid production, and hydrochloric acid is produced in a stomach wall, right? So liver qi stagnation becomes a stomach qi stagnation because the liver will offload into digestive system. Between others, it will offload in the respiratory and cardiac system as well. So that's what we're talking about: liver yang rising or liver qi invading the stomach in TCM language. So we have, as I mentioned, stagnation of liver qi that invades the stomach. So the formula that we prescribe here is modified Chai Hu Shugan 1 or Chai Hu Shugan San if it's a powder. If it's one, and then it's a pill. And this formula not only cleanses, it detoxes the liver, it also alters the automatically relationship of the more pH closely balanced blood being shared with the stomach. Therefore, the hydrochloric acid in the stomach becomes more pH balanced, and we avoid the epigastric pain. So at some times, if the liver is so congested and enlarged, we're going to have both pains over the liver, hepatic pain and epigastric pain at the same time. And the person generally is guarding, so that you're going to see the shoulders closing, preferential posture like to flexion, almost like the baby position, because that's where the ligaments are contracted inside, and they feel that organs are more at the rest, and they breathe usually shallowly, so the diaphragm does not compress the organs too strongly. So it's like this posture, like shallow breathing, hyperventilation. And they find that works. So this is one of the diagnoses. Yeah. So if we, let's say, have a H. pylori in the stomach, TCM sees this as a stomach heat that turns into the stomach fire. And eventually the stomach chi that should go downward, carrying the food particles in small intestine, is being projected upward because of the heat and because of the basically H. pylori causing increased hyperacidity in the stomach. So then we start seeing a rebellious stomach chi or rebellious stomach fire that was created by the H. pylori being thrusted forward. And that's usually a precursor of like dental conditions. Like lots of times root canal is not just a root canal. It's actually a hyperacidity in the stomach. And dentists, some holistic dentists will know that in addition of treating the root canal, they would treat the stomach by prescribing antibiotics. And that would actually remedy the pain around root canal immediately, right? Problem with oral use of antibiotic is that then they quash the acidity in the stomach. So the acidity goes from hyper to hypo. And then the stomach will be urge to create more hyperacidity. So it's a vicious cycle that oral antibiotics are causing, right? So they have immediate effect, but long-term effect of antibiotics is not good, right? And an H. pylori survives this attack. And we know it's a very resistant thing to kill, right? And then it's reintroduced back. So we have recurrent H. pylori infection, despite 7 to 9 days strong antibiotic prescription, right? And then, of course, what we eat will help. So, for example, H. pylori people shouldn't eat meat, which is tough. If you're a meat eater and now someone is asking to become a vegetarian, eat like a baby, like cooked vegetables, that becomes a major issue. It's a major lifestyle change, and most of the people cannot do this, right? By introducing proteins, H. pylori is given through amino acids a second lease to life, right? And modern science just avoids that. Like they don't talk much about it. It's, just repeat another course of antibiotics. Yeah, so. Okay. So this is just an example of what we covered. So let's look at accumulation of heat in liver and the stomach. So we're seeing it something similar. It's not a liver chi stagnation here. It's possibly something after liver chi stagnation. So a secondary thing that is happening in the liver. Now, could be pre-existing liver cirrhosis. Could be a lifestyle, like a heavy smoker, drinker, and so on, right? That is causing ongoing inflammation in the hepatic tissue, in the liver itself. And so like we know that we call it pathogenic triad is drinker, smoker, and it doesn't sleep much. This will cause major inflammation in the liver. Because between 1 and 3 a.m., liver pulls 1/3 of the blood to help rejuvenate hepatic cells. If you do not sleep, your liver do not regenerate. And then in the morning, you start with the deficit. And if this is repeating, it leads to severe impairment of the liver. And on top of that, you're smoking and you're drinking. Your blood is changing. It's becoming less and less alkaline and more acidic. And the liver, like this weak liver, is taxed nonstop. So it's a good candidate for, if it's a woman, fibroids, tumors in the breast, if it's a man, cirrhosis, liver cancer, and so on and so on. So the sex will steer the pathology slightly different in a man and a woman, right? If you're in this triad. So majorly altering your lifestyle. Oh, and shift work, which is not always seen as a pathogenic, but it is, because it alters majorly our biorhythm, right? Okay, so in addition of this sudden burning pain in the stomach, we have acid regurgitation, dry mouth, bitter taste, thirst, preference for cool drink, and restlessness. Restlessness here is not just physical, it's emotional as well, right? It's a psychosomatic kind of response to this. So modifying Hua Gao Jian is used here, release the liver powder, right? So what it does, it sort of realkalizes the liver forcefully. So it's like a equivalent of someone, like a firefighter taking that CO2 apparatus and just, you know, basically freezes down that fire, like kills it. So this decoction goes in and forcefully, like via stomach and hepatic parallel network, cleanses the liver. Problem with this decoction, it causes contraction of the liver in large quantities. So it actually can cause more pain. Okay, so we have a reddish tongue with yellowish fur and a taut, slippery, and rapid pulse. So when they say here liver, they're also alluding to gallbladder as well. So there's not just pure heat; it's a slightly damp heat. Actually, it's a heat damp. So I'm going to talk a little bit ungrammatically in English. So in Chinese medicine, it matters which word is first. If we call it damp heat, it means the dampness is a pathogen of the choice, like it's the major player in this pathology. Like, I don't know, let's say 70%, and the heat here is a junior partner. If we say heat damp, which doesn't sound grammatically correct, it means the heat is running the show, and it's a major pathogen in this relationship, and the dampness is only secondary. So they're implying here a heat damp. And when we have heat damp, we have a bit of a slippery pulse there, which means you probably have some kind of secondary gallstones or something, blocked gallbladder ducts there in addition of the liver. And it's interpolated between liver and gallbladder. No. Then it would be called damp heat. So here we're talking really about heat damp. So damp is sort of hidden, right? But you can see it through slippery pulse. So here, I mean, that's what they're saying. Smoking and drinking will induce stomach ache or like stomach pain. Tobacco and alcohol belong, like they create fire and heat. They create acidity. So the triad, and sleep is the one that usually they don't mention, but it's very important. Physiologically, sleep is one of those factors that we talk, but it's hard to regulate because it's a lifestyle factor. And unfortunately, the common population of Earth, they did in 1910 a worldwide study involving 6 million people, and they discovered that on average, so that's a pre-industrial revolution, right? Just before steam engine and all that was invented, it was 10.7 hours the world was sleeping. And now we're down to 5. So 100 years later, 2010, they did a similar countries, similar amount. Now we're down to 5.3. Yeah, stimulant, right? You get second wind somewhere between 11 and 12, and it's hard to fall asleep. Even you're tired, you're excited because you took a stimulant. Sugar, caffeine, chocolate with lecithin in it, or alcohol, all the stimulants. That's why we like them in the morning. Hot cocoa powder, good good cup of coffee with some sugar in it. It's like a defibrillator, especially if you didn't sleep much, right? It just kickstarts you, right? And you're on with your life. But the fact that you took a potent diuretic that will dry you even more, right? Because you're going to urinate, you elevated your blood sugar so much they will elevate and then drop even lower. That's why on the way to work, if you don't sip your coffee, you're like, fine, trying not to hit the guy in front of you. Okay. So it's a prescription. So blood stasis. So implies there's also chi stasis here, because chi stasis is precursor to blood stasis. So pain here in the stomach, it's like needling, cutting, or stabbing. It's a very pointy pain with blood stasis. More so if it's pure blood stasis. If it's chi and blood stasis, pain would be less of a stabbing with a knife, more like a pins and needles, but felt deeper, not superficially. And it's fixed, and it's very tender to touch. So these people do not like to be touched there. And if you examine, you press, they'll almost like push you away. Right? So generally, this implies chronic nature of the disease. It's recurrent. For women, they may have also menstrual issue, fibroids, so on and so on. For men, they may have a issue with the cardiac system, and sometimes, it may be suggested they look for aortic aneurysm, just to check. Tongue here is usually dark with purple overturns, sometimes strawberry tongue on the tip or in the middle, and the pulse is usually very tight, possibly wiry, and sometimes irregular, which points to probably cardiac involvement. So generally, there's some kind of blood stasis due to cholesterol, again, liver, possibly another chronic conditions in terms of like for female population that contribute to this blood stasis. So this is really a systemic blood stasis that we feel it in the stomach. So Shishao powder is used as immediate prescription. This formula does not actually cause the curative effect. It causes the reducement of the pain. So it's used like as an analgesic. Insufficiency of stomach in. This is ultimately a chronic condition of the stomach where the pain is always there. It comes and goes. It's usually between 1 and 6. People feel thirsty and dry, but they don't drink much. They constantly have a dry throat and the mouth, and they're sort of having like a drier stool, and they're constipated. And so we need to sort of like use the formula that. So here we use Yang Wei tongue that will basically nourish the stomach yin. It will help the stomach to basically reconstitutes that mucosal lining around, but it also helps to coat esophagus, reducing that feeling of thirst, parchness in the mouth and the throat. So we're talking about stomach yin tonification. Spleen and stomach yang deficiency. So this is like sort of distending pain that's sometimes a bit migrating, and it oscillates. It goes from mild to stronger, and it increases after we're exposed to the cold or eating something that induces the alkalizing cold-like action in the stomach. It's better after we ingest something warm and we apply the heat source over the area. Modified Huangqing Jianzhong Tang is used here to basically build up the stomach and spleen, qi, and the yang. Increase digestive rate, and just to increase the circulation in the middle jaw of the qi and the yang. This is an example of another decoction, Xiang Sha Liu Jun Zi Tang, and it's used also for spleen and qi pathology, but also for follow-up spleen and stomach yang deficiency caused by internal cold. So heat-in syndrome. So here's what we discussed it with E. coli and some other sort of viruses being in the stomach. So it's a heat that's caused in the stomach, but it's also indirectly caused by liver qi stagnation. So it's a double pathology, right? And it impacts the stomach by causing hyperacidity. Okay, so cold syndrome that we mentioned before. And that's the end of it for the epigastric pain. Yeah. Okay, so we're going to talk about hypochondriac pain, or a pain that it's mostly felt over the liver region, right? So it's right off the center. So the main principal points for this are liver 14, which is a front move point for liver, yeah. Sanjiao 6, gallbladder 34. So we have a local point here. We have a distal systemic point, and distal systemic point. So one local and 3 systemic points. For stagnation of liver Qi, we would add the liver 2, liver 3, and the herbal formula would be Chaihu Shugan 1 powder or Shugan San. If we have blood stasis in the liver, we would add bladder 17 and local points, and we would use Xuanfu Hua Tang decoction. For the dampness and heat in liver and gallbladder, we would add Ren 12, spleen 6, and we would use Longdan Shegan Tang. For insufficiency of liver yin, we would add Bakshu point of the liver, bladder 18, Bakshu point of the kidney because it's a mother organ of the liver, and we would use Yiguan Jiang, which is a linking decoction to connect the liver and the mother, the kidney, right? So hydrating the liver. So hypochondriac pain refers to disease characterized by painful sensation on one or both sides of hypochondriac region, mostly on the right side. It is subjective symptom frequently encountered in the liver and gallbladder diseases, such as acute chronic hepatitis, cirrhosis of the liver, carcinoma of the liver, acute or chronic stones, biliary blockage, and intercostal neuralgia over the area. Yeah. Occurrency is usually the concern is if you have occurring pain, is there something similar, like serious, like a carcinoma of the liver. So the imaging will be done, a blood test will be done to rule out any potential, fatal diseases, right? This can be caused by chronic exposure to emotional stressors, traumatic injury, which causes liver to swell, blockage of the gallbladder, flow, like a bile flow, right? And any other like lifestyle substance abuse, like a long-term chronic alcoholism, recreational drug use, smoking, working in asbestos industry, or any other toxic, or both sides. Yeah, what they mean is they mean about liver invading the spleen. So yes and no. I think if you're splitting hair, probably no. But I think it could be probably splenomegaly, enlarged spleen that is caused by the liver. I think right side. Absolutely. Yes. If you want to be political, like the right side only. No, good question. Yeah. Yeah, but I mean, yes. Yeah. Generally, liver's not considered left side or anything near left side. True.
Yeah, and it's also not like I
Well,
know.
some anatomical books will actually name both sides. Yeah, you'll see in some books. In some books, it's just a one. Yeah. McBurney's point, like in terms of it, appendicitis. Oh, sorry. Yes. I was thinking about the appendicitis points when you mentioned. Yeah, sorry, but yeah. But there is referral. There's referral about T7, actually T8, like mid thoracic or lower thoracic, however you want to see the thoracic, right? Yeah. Okay. So chief complaint is pain on the right side, to be correct. Person was reported as a distending, wandering pain. It's relieved or aggravated by emotional stressor changes. It's alleviated by belching and flatulence. May cause anorexia through poor appetite. Generally, it's seen as through the wiry pulse, white, pale tongue with a thin white coating or no coating at all. Blood stasis is manifest as a stabbing hyperhidrotic pain as opposed to distended by the liver Qi stagnation. And damp heat in the liver and the gallbladder is also distending pain in it. Just to sort of differentiate them. Primary treatment, as we mentioned, is frontal point of the liver, liver 14, and then distal points, they're also systemic. Sanjiao 6, gallbladder 34, stomach 36. Supplementary points are liver 3, liver 2 for the liver chi stagnation, bladder 17, and local points for the liver blood stasis. Ren 12 and spleen 6 for accumulation of the damp heat in the liver and gallbladder. And bladder 18 and bladder 23 for the liver yin deficiency. So I'm going to speed up a little bit, guys, because we have like 3 more conditions to cover. Auricular acupuncture treatment treats the, sorry? Oh, 4, okay. Okay, we could skip it. So yeah. Okay, sure, we can. Are you okay if we skip it?
Yeah, skip the auricular.
Okay.
Okay.
Okay. So here is just a differential diagnosis, right? So you have hypochondriac, epigastrial, so similarities and radiating parts and differences, right? And it's a good thing to have because it helps you differentiate. So, okay, so for stagnation of the liver, the formula we're going to cover is Chai Hu Shugam San. For the blood stasis, the formula we're going to do it is Shuan Fu Hua decoction to activate the liver circulation. For the dampness and the damp heat, actually, in liver and gallbladder, we're going to use Longdang She Gantang decoction, which is an antibiotic, and it leaches the damp and heat out of gallbladder and the liver. For liver yin insufficiency or liver yin deficiency, we're going to use the linking formula, Yi Guan Jian Tang, which tonifies the kidney and the liver yin. So, preventative stuff, be happy. Yeah. Avoid being stuck in any emotions, so keep your emotions on even keel. Eat well. Eat less spicy and pungent, greasy, and seafood, not seafood. Do not drink alcohol if you can. Lead a regular and moderate life. You can do some self-care, self-massaging, and do low aerobic exercise. I have no idea because I don't have a book on me, but I'm assuming it's probably at the end of your chapter. This is just the preventative stuff. You don't have it? Okay, so that's another thing we're gonna add. Okay, so we're gonna add that in a book. I apologize that. Yep, sure. Going back. Yep. Oh, okay. Here we go. Okay, good. 68 it is. Okay, wonderful. No problem. No problem. As long as we can find. Okay, so we are at abdominal pain, colitis. So not epigastric, more abdominal, so more general in a sense, right? Larger area. Principal points: distal stomach 36, local Ren 12, local stomach 25. So it shows you how big this area is, because you go from the frontal point of the stomach down to frontal point of large intestine, 1.5 on each side of the umbilicus, Ren 8, right? And then spleen 6, distal points. So beginning and end are distal points, the middle are local points. And this is, yeah, I was like, maybe. Thank you. For the sort of pain that feels like cold and chilling, we add Ren 8. Now, Ren 8 is the umbilicus. We do not needle it. We would use moxa on it, right? So you put like a salt inside, you put a slice of ginger, aconite, or garlic, and then you can put the direct moxa, or you can use the moxa cigar over it, or TDP lamp. Yeah, this is a restricted point. We do not needle it, right? So it could be a trick question. If you put it there, Ren 8, you need to explain it. What would you do with Ren 8? Don't put it under acupuncture, right? Ren 8, umbilicus.
No, awareness.
Yeah. So just so you know, um, spleen 4, right? And the formula is Galiang Jiang Tan. Umbilical and abdominal inflated area cause the pain. We add liver 8, we add spleen 10, and the formula is okay. I'm sorry. Okay, one at a time. Why we add liver 8 here? Because this is due to the blood deficiency, blood stagnation. Sorry. So Shu high, spleen 10, and the liver 8 combination powerfully moves circulation in the lower jaw, because liver, even it's anatomically in the middle jaw, actually energetically in Chinese medicine it's in the lower jaw. It's seen as below, like in the lower chamber. Liver, yeah, blood stagnation, yes. Yeah. Basically ingesting too much of I guess herbs that are cold in nature, like prescriptively, or maybe drinking too much some kind of herbal tea, we would add a spleen 4, and the Yi Sun is the herbal formula. Cold-based insufficiency in the stomach area, so in a visceral area, basically an abdominal area, we would add the back shu points for the spleen, back shu points for the stomach, and front mu point for, what's the liver 13? Spleen. Okay. So this is like a actual treatment pattern. Heat stagnation in abdominal area. We add spleen 9 and stomach 44. Now, this is heat damp. Dampness is sort of implied. Why? Because spleen 9. Because for damp heat and heat damp. Abdominal area and heart area pain, they just add Miao Sun formula. There's no, I guess, points. I mean, we could add points. We could treat from the back. Shu points, bladder 15, and PC6. Food and qi stagnation in abdominal area. Liver 8, spleen 10, so to move the stuff around. And the herbal formula is Muxiang Bilang 1. Full abdominal pain followed by the weak pulse. Add the liver 8. And I would add spleen 10 here as well. Shao Yao Tang is the formula. So you notice, because it's a whole area, the approach is a little less precise. It's more ambiguous than, let's say, hypochondriac or epigastric area. It's a little kind of like undefined in a sense when you're looking the points. There's no this laser-like kind of approach. Let's go after it. Local dist. Exactly. So it's reflection of the sort of adaptive medicine here, because this is a big area. There's lots of stuff here, right? That could be abdominal. Lots of organs packed in it versus, we're just having a problem with stomach as organic system or liver, right? I think I would leave it here. I wouldn't go more into it. So because there is really no more, because as you said, it's adaptive. So depending what's going to be presented to you as a questioning, it may point to one or two organ involvement. And that's a trick question because both have floating pulse. So you can't look in a pulse for differentiation between wind cold and wind heat. You look in headache, frontal for the wind cold, occipital for the wind heat, sore throat with the wind heat, no sore throat with the wind cold, chills and fevers with the wind cold, only fever and thirst with the wind heat. And the tongue, little or no coating for the heat and some coating with the cold. Okay. So my left hand's going to be wind cold. My right hand's going to be wind heat. Wind cold, so this hand, frontal headache. Sorry, I apologize. Wind heat, frontal headache. Wind cold, occipital headache. Right? Yeah, Tai Yang is here. Sore throat, wind heat. no sore throat here, at least not right away. First 24, 48 hours, yeah. Chills and fevers, wind cold. Only fever, wind heat. Red tongue with little or no coating, wind heat. Pale tongue with some coating, wind cold. Right away you differentiate. And they have to give you these because these are major symptoms. So tongue is for wind heat, red tongue with little or no coating because the heat will eat the moisture. Well, both can have that, so that's not a good differentiation. Both have a tip. And a tongue on a cold will be pale tongue, generally pale red, with some coating on it, usually white coating. Yeah. So right away, and they have to give you pulse, they have to give you tongue in a scenario. So sometimes you can't trust the tongue. Sometimes you can't trust the pulse. Actually, tongue is truer than the pulse. Pulse can be very similar in many things, and it's confusing. And it's very subjective. Tongue is like whatever you see, I see. You know, red is red to me, orange is to me, unless I'm Daltonist and I can't see the colors. So tongue is always more true than the pulse. Pulse is very subjective. So I would say if you have to pick between those two, pick always tongue. Because we can all agree on a tongue, but we're not going to agree on a pulse lots of times. Right. Oh, my pleasure. Okay, so we're going to just, okay, so how do we go to next one? Vagus sciatica, very common, right? So we see this a lot, especially because we're a population who sit a lot. So principal points, local points plus bladder 25 and bladder 40. I would say gallbladder 30, not included here. I would add it. Please do add it. Yes, yeah, yeah. You can probably like. I think we may run into it later. Let's see. I would probably say it will come with. Let me see the syndrome. Yeah, yeah, yeah. So yeah, it's there, but it could be a main point. No, no question about that. Yeah, I agree because it relaxes sinews, as you said, connective tissue, right? Okay, so cold damp. Please do pay attention to grammar. So cold is predominant, damp is secondary player here, right? So that means there's a constrictive physiological reaction and energetic reaction in the local region. It's like someone is like squeezing you, like the cold does that. It causes constrictive fascial constriction that traps the blood and chi or local circulation there and puts the pressure on the nerve ends and proprioceptive cells, on like nociceptors, like the pain receptors, right? So in this case, with the cold damp, you go to do 2. So it's basically like do 4 is at level what? 2 L2 and L3, and do 2 is down to where? No, L2 and so do 4 is at L2 L3, and then where's the do 2? Yeah, that's about that region. Yeah, so it's basically sacroiliac border, right? So Du Ho Jisheng Tang is a very known formula that brings more like a circulation into it, but it warms up the area as well. Damp heat. So now we have altered. Damp is the one that so it's constricting, but not as constricting as a cold. It's more like heavily weighting you down, but some constriction. And then to make things interesting, there's a heat there, right? So so here we have a spleen 9 to push you to urinate more, right? This disperses the dampness. And you have spleen 6 that regulates the plasma in the blood. And then you have bladder 40 as a lever point all the way there to release the tension from here down there, right? And then formula is Jiawei Mia Sao, right? So alter the two meow meow meow. Meow is what's the meow? Yeah. No, it's It's I forgot what meow means now. Okay, it'll come back to me. Too much talking. Wind damp. Again, wind is the carrier. So whenever you see wind, it means fast, acute, acting pathogen. So it comes in quickly and moves fast through the body. So neurological response, right? And then, so yeah, like punches in the face and leaves, right? So wind damp. So and then dampness is like sort of minor. So there's some kind of constrictive ability there. So it's like entrapment, right? Acute entrapment. So he goes and person comes and says, I was sitting and something just pinched me, right? And I can't move, or I can move but with great difficulty because it's pain controlled. So this is your wind damp, right? Described in Chinese medicine. So spleen 9, do 2, right? Wind cold. So again, quick, but now fairly constrictive, not a sort of semi-constrictive. So do 2 only and probably moxa, right? And then formula is Jingfang Baidu San. Wind heat. Spleen 9, spleen 6, Shao Chai Hu Tang. Deficiency of the kidney. Possible yin and yang. Why? This is the yin point, this is the yang point. And this is bladder 52, it's second line bladder point, so it's also a yin point. So yang, kidney yang, milder pathology, and working toward the kidney and deeper pathology. So kidney pathologies go like this. Kidney qi, if it's not treated, kidney yang. If it's not treated, kidney yin. If it's not treated, kidney jing. Qi, yang, yin, jing. Now, some people just skip. Depending on constitution, they may go like right away to number 3, right? But textbook, you go from qi to yang to yin to jing, right? Traumatic low back pain, so some kind of trauma, impacted trauma or something like that. Usher points first, right? And then gallbladder 34, bladder 57, right? Weight zone bladder 40. And then in acute stage, this is like an analgesic formula, Daji Ganju Yutang. And then in a chronic stage, it's another 2 formulas combined together. Mm-hmm. So text, yeah. Yeah. So it affects the qi first, which is a milder functional pathology. So it affects the qi. So what does that mean? So mild numbness and pain interplayed. Pain is maybe migratory. Your overall function is not severely impacted. So you can function. Yang, now we have everything with the qi plus some systemic issues are impacted. So for example, nocturia, more peeing at night. Sensitivity to cold, a low sexual drive, short-term memory impact, but still at the level where you can function. Kidney yin. Now things become progressively long-term and they impact you more. So majorly short-term memory problems. In addition to the low back pain, now we have knee pain. And it's impacting you standing and walking. Your nocturia, not as bad now, but now it's daytime. So you polyuria daytime. So you pee more daytime. You chronically dehydrated. You have problem with standing. Sexual dysfunction, major. What else? Tinnitus and vertigo, ongoing. While in kidney yang, tinnitus may come and go. In kidney yin, it's ever present. It's like your companion because it's chronic. Kidney jing, loss of hair, loss of tooth. So you're equivalent of 90 years old person, right? But you're not 90 years old. You're 40. So just overlap. General disease progression. And of course, no one is like that. Very few people travel textbook, but it's put it there in the book so we can see progression. People are generally a mixture of a couple of these because when it happens in the kidney, it affects other organs. So there's interplay between kidney and other organs. So then you have like secondary conditions. This is just a kidney line, yeah. So, but we just saw it in isolation, right? Okay, Yao Tong, and that's how Chinese called lower back pain. But here we also have sciatica thrown in as well. Differentiation between lumbago and sciatica. Lumbago, so pseudosciatica. So lumbago that's mixed and looks like sciatica is it's bilateral. Sciatica almost not written in a stone. Almost majority of the time is unilateral, so one-sided. Pseudosciatica looks low back involvement plus bilateral transmission or radiation of the pain into popliteal area or down all the way to the heel, calcaneal area. So that's one of the major differentiation. Of course, we can do compression test with a straight leg test together to rule it out. One leg, another leg. We can do a compression test over piriformis, the true name of the sciatica, right? We call it piriformis syndrome. But one of the major differentiation is that it's unilateral. You know. Okay. So so here we have pathological explanation. Can be caused by invasion of external pathogen or internal pathogenic forces. So external one is wind, cold, and wind heat, or wind damp. And then we have internal ones such as stagnation of qi and blood, trauma, sprain, and some kind of kidney deficiency. Primary treatment, we also mentioned bladder 25 and bladder 40. Supplementary points here, and this is supplement for, so bladder 23, local point, Ming Manchu or Du 4, local points, Jishi or bladder 52, local points. So 3 local points, 1 other local point, and 1 distal point. And so bladder 40 is a major tangent point. It's a point that uses the diaphragmal-like motions like that we have. So we have many diaphragms actually in the body. We usually say, no, we have only one. Well, armpit is one diaphragm. It's a pump. Your cubital area is another. Your wrist is another. Your inguinal area, the Chinese call gua, is another pump, right? Your popliteal area is another pump. Your pedal pump pushes the fluids, right? So we have many of these pumps or like diaphragm-like. So that's why we take advantage of the points in them or around them. And bladder 40 is one of those points. And also myofascial chains connect there and reconnect. So that's why bladder 40 is used to connect that myofascial tightness that goes from the lumbar area. It's bridged here to the heel. So in Chinese terms, when we looked at bladder 40, we said that this is like a point where we regulate myotendinous meridians or tension in myotendinous meridians. So no different than myofascial chains we use in osteopathy or chiropractic or physiotherapy terms, right? I mean, Thomas Myers made a fortune out of this, right? So, okay, so this is the major sort of approach through this because it covers also sciatica and covers the lumbar area. And for Chinese, lumbar area, interestingly, is from slightly like a lower thoracic, so like I would say T10 to about halfway through, so basically to piriformis level. So this is for them lower back. And you know, in the West, we usually know lower back is like from probably like sacral kind of line to about what T12, L1, and they're like no. So kind of abdominal epigastric kind of play. So it's seen here as well. Like they have a larger area and then they'll narrow it if needed, right? But you notice that one of the first statements here was first point were Usher points. So he recognizes the sort of need to modify the treatment itself, that you may not go to any specific points on the grid. on the meridians. But instead, you may use the painful points, the myofascial trigger points, or whatever you palpate, you would treat, right? And then you would complement this by the next systemic point, in this case, like bladder 40 or some other local points around. So the statement here is that first you explore, and then you complement by the known points that may have effect on this. Because QL goes in a cross, right? So it goes from the iliac crest, right, and inserts so in a cross. Yeah. So which stream we're talking about? Well, there are the so there are local points that would be overlapping, so Usher points that we would treat the QL, but there is also couple systemic points that are not even close to QL that will treat QL. So one of them is Kunlun, bladder 60. Another one is Tai Chi, yeah, bladder 60. Another one is kidney 3. And they're as far from QL as they are. Yes, we may treat the QL as well in a systemic way. Right. So, and then there are local areas. Problem is, not everything is, it's related anatomically, but not in TCM. We don't have always like exact response because the Chinese doctors recognize that, you know, people change, pathology change. What works for one person may not work for another, or work on your right side may not work on your left side. So you need to modify, which makes it for extremely messy, pluralistic way to learn medicine. Absolutely. That's not even mentioned. Thank you for reminding me. So Yao Yang is one of the major points we would use as a systemic points for Yao. Like, so that's the point on the dorsum of the, so it's an extra point, right? Recognize it's on the dorsum of the palm. It's between the fourth and fifth and second and third interphalangeal space. Yeah. Yeah, so you always use them like in pairs, and you can use both hand. And actually, in China, what they have here, we don't do it. They needle you, and they have you like move your waist. Like they'll have you like put your hands up there or hug yourself, so you know, so the needles are fixated, and then they'll have you exercise, and immediately releases the fascial tension in this area. And it's just use these 4 points. Occasionally, they may add small intestine 3 and bladder 62 to augment, and then you're told not to move, like not to step, but actually to move in one spot. When I was in Zhengzhou last year, I saw a number of acute cases of lumbago. They are released, and the patient like literally come like this, like they carried, and then they needle them, and then they start moving like this, right? And then you see them how they're slowly opening, and then later you have like dancing guy, right? So it works right away on myofascial tightness. So talking about empirical knowledge. So we're going to repeat the question for the guys who are observing it. So the question was, he asked about the name of the point. The first gentleman asked about QL questions. Which points will cover QL muscle, quadratus lumborum? That it's antagonist of the iliopsoas in a sense because it's a hip flexor extender. So our answer was that it's a Kunlun bladder 60, Tai Chi kidney 3, gallbladder 34, and the local Usher points over the area. And the second question, or actually second answer, was that we have Yao Tong points on a dorsum of the palm. They are used, and they're specific points just for low back pain. So they're called low back pain points. And yeah, like kind of same as what we call the. Yep, sorry. So Yao Tong Shui, the Yao Tong points. Yeah, so they're called Yao Tong because they not only work on low back, but they work specifically just for lower back and associated things. They also use for sciatica, right? Okay. So here they're stating it why they picked these points. So they say Usher points are picked first, and then we picked bladder 25 because it can promote qi and blood circulation or affected channels. And affected channels are Tai-Yang channels. So here we have basically a bladder channels, right? The two lines that go over it. And the bladder 40 is used as well because it's a key point for lumbar area, and same reason for opening the blood circulation in the bladder because it's on the bladder, but it's a lever like a point, right? Another thing I saw in China, they use backward walking to reduce the tension in the lower back. So patients are taught to move in a circle or in a straight line and relieves the low back pain. And he does. They may be needled or may not be, but they actually taught to go home and then pick the safe area and walk backwards. And actually they use back more like musculature that we generally don't use, and it rebalances the agonist-antagonist relationship between iliopsoas and QL. So it reduces the tension in the lower back, especially people who stand or sit too long. Okay, we're gonna go over this area. So one of the things that we use in acupuncture a lot is plasters, herbal plasters that we put on the lower back pain. So if you want, you can put that on exam. I think it's a nice bonus. So we use things like a Yunnan Baiyao plaster, or there's a Wu Yang plaster for low back pain. So they're adhesives with the herbal paste on them, like a 1 millimeter thick, and you apply them, and generally patients wear them for 6 to 8 hours. The best actually use is when they go to sleep, because when you sleep, we don't move much, so our circulation is really limited because we want to fall asleep, right? But that also induces more pain. So if you put those strips over the area where it hurts, they activate through pressure and the heat, and you have more body heat when you're covered, and they're constantly causing drawing of the local circulation by vasodilation. And they're anti-inflammatory, those herbs that are painted on them, and actually pain is reduced significantly at night. The problem with that plasters is you can't wear them for too long, 2-3 nights, and then because skin doesn't breathe, it creates the skin burn. So you gotta, and some people last only 1 night, other people last 5, right? Even with those holes in the plasters, like adhesives, right? It's really good therapy for low back pain. Okie dokie. So I'm going to just quickly go over the formulas. So, Du Huo Ji Sheng Tang is the formula that we use for the cold and damp. It's a diuretic formula that disperses the cold and drains the damp. Okay. So for damp heat, we use altered two marvelous powder formula. I remember the name now. So Jiawei Miao San. So two marvelous powder formula. There are two marvelous powder formula, and I remember because I read it here. So we have also San Miao San, and what's the 4? What do we call 4 in Chinese? Yeah. So there's San, Se. Yeah. So there's the 2, 3, and 4 marvelous powder formulas. Yeah. Thank you. Yeah. So for damp heat. Wind damp, we use this Qianghuo Shengshi Tang. And so it's a formula that drains the damp and reduces the neurological excitation in the system and reduces the pain. Wind cold, Shizapeta and Ledaburia powder is analgesic formula, Jingfang Baidu San, that it's used to offset the wind and constrictive action of the cold. Wind heat, minor bupleurum, formula Sha Chai Hu Tang, works in the liver, works on kidneys, particular kidney yin level. And here's like some of the herbs you see here. Deficiency of the kidney. So there are a couple formulas. One of the so there are two formulas we call treating kidney left and treating kidney right. Yogui one is treating kidney right. It treats the kidney yang deficiency. The Zogui one is treating the left kidney and treating kidney insufficiency. And the reason why these names, right and left kidney, is before Tang Dynasty, doctors thought that the right kidney is the kidney yang and the left kidney is kidney yin. After Tang Dynasty, actually after in Song Dynasty, this was changed physiologically. They reached a different physiological explanation. And both kidneys were kidney yin, but supraadrenal glands sitting on the kidneys were kidney yang. But the name stayed with the formula. So treating the right meant treating functional disorder or kidney yang, and the formula was called Yogui one. And treating the left kidney or treating the structural or kidney yin pathologies was called Zogui one. So it was Zougui. So Yogui one and Zogui one. So treating left and treating right. So left is yin, right is yang. Okay. Okay. And here we go. Actually, Zogui one, yeah. Okay. Traumatic low back pain. So actually, for traumatic low back pain, one of the best formulas, you know how we had Shu Fuju Yutang for upper, we have Shao, SHO, Fuju Yutang, lower blood mentions. So there's upper blood mentions and there's a lower. Shao Fuju Yutang is used for gynecological issues and the lower back and sciatica problems. Dajinganju Yu is a cousin of that formula and could be used as well. It's an analgesic formula for the lower back pain, for trauma and acute presentation of the trauma. For the chronic stage, you have like two. Why two formulas? Because it's complex, so they need to have two overlapping formula because there's a multi-pathology going on, because time allowed it for multi-pathology. So they're trying to overlap with two different formulas. And that is the sciatica and low back pain. Next stuff, right? So principal point, notice same as with low back. First points are usher points, local points. Treat what you find. Then, well, yeah, I mean, like you palpate and treat, right? Then you throw in the known points there. But you could say usher points. Why not? But as long as you don't say just usher points and nothing else, that's faking it. Let's say, well, yeah. So you could say usher points, treat the local painful points, plus blah, 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 right? And they can't say nothing. That's actually a very good answer, especially if it's a pain condition. So it's a nice way out. So basically, okay, so let's look at this. So neck pain, right? We start with usher points, then we go to small intestine 3. Why? Small intestine 3 controls the sides and partially back of the neck, right? Gallbladder 39 here controls the fascia as well. And we have Luojian Shu, which is extra point that controls the neck as well, right? So these are the main points that we would use for the neck issues, right? The neck sprain and stiff neck, or any pain in the neck. And then the first syndrome that we're covering is invasion of the wind and cold. And we said the wind and cold has affinity for the back of the body because the back is the yang, and the front is yin. So when you have a pathogen is a cold and yin, it wants to go and be paired with the yang side of your body. So we would say that it would cause like a constriction of myotendinous part of the meridians at the back. So naturally we would pick like a point like gallbladder 20 because it's a local point. And also we saw that the large intestine 4 also controls the side. So between the large intestine 4 and small intestine 3, so these 2 points, you're controlling sides and the back of the neck. Yes. In let's say a case where you have someone who's coming with acute torticollis, and it says they slept in a room, for example, it was drafty, and by the morning it was like this, right? It says please help. So in that case, I would do reduction on the large intestine 4, and I may do moxa locally over the area. So I may do large intestine 4, small intestine 3, gallbladder 20, and I may do moxa, especially on contracted side, right? So and then maybe do some gentle mobilization, probably like a muscle energy type of energy. We don't have it in Chinese medicine. We have something else in Tuina. So something like that. So that would be a sort of my approach. So Guggen decoction is used for this wind cold, right? So qi and blood stagnation, and here qi and blood stagnation are mostly in the tai yang, so in the bladder and small intestine meridian. So the points here are large intestine 15, Sanjiao 5. So large intestine 15 is a local point, right? Sanjiao 5 is systemic point. Small intestine 14, local point. Small intestine 11, sort of like a, not quite the local point, but nearby point. Yeah, adjacent point. Very good, thank you. And then Shentong Zhuyu Tang decoction is the major decoction for systemic qi and blood sort of deficiency or stagnation. Sorry, not deficiency. First, for deficiency, Shi Quan Da Butang. So, but in this case, because we're talking about bladder, and bladder is one of those biggest meridians, right? It's almost like systemic because bladder starts at the front and goes to the back, right? So it's equivalent of basically all the yang of you, all the yang side of you. So we treat it as a systemic stagnation of the qi and blood, like this whole body's qi and blood stagnated. Right? So stiff neck, Luogen, it's basically condition of the restricted range of motion, limited by pain, and generally it may be caused by invasion of the wind cold, or they call it cold evil here, which causes muscle spasming. And then we have one side is overcompensating, it's contracted, another one that's overstretched, right? So concave and convex side, right? It mostly occurs in adults. It could occur in children. It could occur in a middle-aged and older people because of the age and inability to move around, right? Kind of like they call a frozen shoulder, 50-year-old shoulder in Asia, right? Because you don't move much, so then you can just move your hands up to here, and there's no way you can do this, right? So here we see this. It could be sign of cervical spondylopathy or something else. It could be also a sign of the trauma, like common trauma we see in our country is, sorry? Car accidents, like whiplash. I mean, it's like a whole industry there, right, for that. Yeah. So principal points we already covered, right? Usher points, small intestine, gallbladder 30, and extra points, right? And then we talked about supplementary points. So gallbladder 20 and large intestine 4 was for wind cold invasion. Large intestine 15 and Sanjiao 5 for shoulder pain associated with the neck pain, excuse me. Small intestine 14 and 11 for upper back pain connected with the neck, so basically in between scapula. Acupuncture and moxibustion can be very effective. Actually, moxibustion could be even more effective than acupuncture here, especially if it's a wind cold syndrome. Acupuncture works more effectively than needling, faster. Right? Your patient may not like the smell. You may work in a clinic like this one where there's shared air, so you may not be able to do moxibustion, but it's a fantastic modality for that. Yeah, so let me just go quickly through decoction. So for the wind and cold, it's Guggen decoction. So it disperses the wind and reduces the cold. For qi and blood stagnation, we have the overall Shentong Zhuyu Tang decoction for whole body qi and blood stagnation. Sorry. Man, a little too fast for my own good. And I think that's it. Yeah, yeah, yeah. You guys have any questions? sprains, and this is very general because sprains can be anywhere, right? So so it's like anatomical in a sense. So a principal point for lumbar area and principal point for the ankle here. So let's start with the lumbar area. So okay, sorry. Thank you. So anatomically again, so we saw already these points when we talked about lumbago and low back pain and sacroiliac stuff. So Yao Tong Dian or Yao Tong Shu. So these are the 2 points that we're talking about on dorsum of it. So bladder 23, L2, L3 area 1.5 on each side. Yao Tong Dian or Yao Tong Shu and Wei Zhong. So stuff that we're already mentioning it. Ankle, bladder 62. I may add kidney 3 there. Gallbladder 40. Stomach 41, gallbladder 34 for sure as well. So there's more than what's here, right? Knee point. There's Xi'an, those knee eyes that we talked to, right? So Asher points, Xi'an, gallbladder 33, stomach 34, stomach 36, right? Kidney 10. Liver 8, yeah, vicinity, yeah, especially treating the lateral, like collaterals and stuff, medial collaterals, lateral collaterals, yeah. Shoulder, Asher points, large intestine 15, Sanjiao 14, small intestine 9, right? Elbow, small intestine 8, right? Sanjiao 10, heart 3, large intestine 11, so the local points around, right? Wrist, large intestine 5, Sanjiao 4, pericardium 7, small intestine 5, Asher points around. Hip, Asher points, gallbladder 30, 31, bladder 54, gallbladder 29. So these are like a basic local points. Now there are also other points we can add, right? So now we're playing with near and far again. So do 26 for the sprain and lumbar region, coupled with small intestine 3 and probably bladder 62. Sprain on medial side of the knee, Shu high, spleen 10, spleen 9. So basically, sprains are injuries to connective tissue, muscle tendons, ligaments, circulatory environment around them. So we have typical manifestation as a shortened range of motion, limited by pain, limited by swelling. It could further go into dislocations, hopefully not into the fractures. So when patient comes, they usually present with triad: swelling, pain, reduced range of motion, right? So therefore, our focus is same way. Pain is first, if it's especially about 5, then the swelling, and then the range of motion, right? So sprain would be disease here, to be honest. And you can actually have, I don't think they're going to just go general sprain on you guys. They're going to go very specific sprain, right? So they may say like, I don't know, like particular joint sprain or something like that. So they may say, I don't know, elbow sprain, right? Or strain. Question is which one they're going to use. No. So the disease so disease is elbow sprain, yes, but the syndrome depends on what kind of information they're going to give you. Like for example, how the tongue. Let me make one. So, 36-year-old comes and in your clinic holding his right elbow in a flexion kind of position and tells you that he was just playing squash. And on examination, you find the area is red, it's slightly swollen, it's limited by pain. He's describing it 6 out of 10. He said that He was playing for an hour, then another player just hit him by accident into that area. You try to go open a joint into extension, and it's limited by pain. He can't do full extension. So looking at the tongue, it's red without coating. His pulse is wiry and fast. Sprain will play on whatever happened in him before, like who he is. This Joe Blow probably had some syndrome, but now it will be accentuated by the acute local injury, trauma injury, right? And associated local channel or meridian, right? So give me something. Okay, but give me a syndrome. Bladder? No, bladder is far away. Blood and chi stagnation? Sure, if he's bruising, you can't go wrong if you say blood and chi stagnation. Chi stagnation is, he feels some pain, maybe numbness, chi stagnation. Blood, you see a bruise. Okay. So you can call it local chi and blood stagnation, but where? You gotta. It is axis syndrome when it's chi and blood stagnation, but where? Like, how would you call it? You can't just say chi and blood stagnation. Chi and blood stagnation, where? But you already said, you call the disease elbow strain or sprain, whatever you use it. No, they got to be syndrome, which means he has to have TCM terminology. Sure, you could call it chi and blood stagnation in the large intestine. If it is, you could call it in small intestine if it's more at the back, if it's behind all the crenin. Sure, and you will be perfectly well within the right, and they can't say, no, you invented this. No, I didn't. I reacted, and that's the syndrome.
What about something like an external aggressor invading the tendomuscular meridian?
I don't know if that syndrome exists, but you could try. Yeah, but remember, they are expecting some kind of accepted TCM terminology. So I don't know if we can go like too far. Like they want something that they can say, okay, you are TCM practitioner. Remember, that's what they examine you for. Even you have much more knowledge than what they need. Right? So I understand your frustration, but they're expecting a very narrow band answer. Oh, what did I have in mind when I was saying it? She's trying to draw it out of me. Which organ controls the tendons? So I'm actually stating something, that this gentleman had some liver problems before this injury, and the injury just accentuated it. So we would say the root problem was whatever constitutionally he was carrying it, and the branch problem is what's going on with him. So remember when I said you can have more than one syndrome? I wouldn't go 5, but you can probably have 2. So you could call it a condition elbow sprain, and so you did a disease. That's it. Now you're moving the level down to specific. So you can call it primary syndrome, which really describes the branch, what Chinese would say, like acute presentation, is the chi and blood stagnation in large intestine, right? And then you can go to the Ben, so this is Biao branch, and you can go to Ben or root problem and say, this gentleman had previously, because the tongue and pulse is telling me, a liver something. Well, you would need more to actually define liver yin. Liver yin is a little deeper. You could probably say liver chi, right? You could call maybe even liver blood stagnation if he has purple tongue, but he doesn't. So I would stay with the liver chi stagnation. Yeah. Yeah. Well, you can't put everything there, right? So I'm just giving you this as an example, right? Well, we all carry some syndromes. No one is perfectly healthy. So you could acknowledge it. What else is going on? You don't have to, but you could. I'm a part of a group that worked with WHO. So ICD codes version 11 is due in 2017. They actually have a part called traditional medicine, and 95% is TCM. So it's coming now. and he has all of the syndromes there. Yeah. So you could go just yeah. Sure. So exactly. So it's a chi and blood stagnation here. That's acute stage. It would be. It would be because this guy comes with acute, like because it's not tennis elbow. He played a squash. He would need to come to you without bruising, maybe with the repetitive strain injury. And say, I guess. Yeah. You can't just leave a disease. You got to go into syndromes. Disease is just the beginning, and then you got to really explain to them why you think this elbow sprain is being treated through syndromes such as blah blah blah. So this is where the description in 2-3 sentences will come in, and of course the treatment principle then behind it, because you would just flip all this and say, okay, since I define this as a disease, this is a syndrome, this is what in few sentences. Yes, because you don't have much time. It's beeping something here. Is someone calling? Okay. Okay. Yeah. So yeah, you summarize it well. And it is a bit troublesome. That's why the college adopted partially biomedical terms in terms of anatomical. So it goes from joint to joint to joint, right? And it calls them either sprain or strains. It's simplification on disease level for the TCM. And then we don't treat disease anyway. We treat diseases through syndromes. So then the syndrome comes as a true representation of our treatment. So that's TCM. So it's a flexibility on part of TCM, absorbing out of the medical system. No, you can't do that. Like just because there's no political approved term. Yeah. No, you could, for example, call it chi and blood stagnation, and so you don't have to say it. For example, large intestine. You could call it hand yang ming. Which it is what? It's a yeah. So you're now calling as a pair, stomach and large intestine. You could say that, and that's a legal way to say that someone has chi and blood stagnation in hand-based yang ming channel or channels, and that will be a legal syndrome. Sorry? How TCM works, guys. I didn't invent this. I'm just sharing it with you. So it's how they do what we call Beijing, like, or differentiation. Ben and Biao. If you look any Machioccia books, so the root would be the underlying problem, and the acute is Biao, the branch. Yes, yeah. So you looked into like Machioccia book, he goes through it, right? And he does a pretty good job of explaining this, right? And it is a book for the boards, right? Yeah, you can bring it. It's actually a approved book for the provincial examination. Yes, you can bring lots of books. You can cover your table with the books if you want. Problem is, it's time and your ability to go through it and know what you're looking for. So if you're good at that, you can bring half a library. I don't think they're going to be against you. Well, that's what it assumes. It assumes that you know your stuff, and this is just a mnemonic for you, like something to just. Yeah.
To make sure it's exactly what you think it is,
then
it's a good thing. But
yeah. So here they're saying that so the sprains, so I guess they're defining for you, right? So sprain caused by violent movement, improper posture, trauma, so on and so on, overpulling on soft tissue such as muscles, tendon, ligament, and vessels, and further it causes the chi and blood stagnation. Right? So you cannot go wrong, especially if you have bruising, to call it chi and blood stagnation, especially blood, because there's a physical result there. So there's a bruising and hematoma. In TCM, that is a chi stagnation and blood stagnation. Right? And then, of course, you'll have a triad, right? It'll be swollen, it'll be pain, and it'll be reduced in a range of motion of some kind, which is limited by swelling and pain. So this is where they're basically just rehashing it. So there's a pain, there's restricted joint and motion, swelling, redness and bruising, and that's chi and blood stagnation. And then therefore you gotta, and one more thing, the TCM now postulates something that when you have chi and blood stagnation, you can absorb more of the so-called external pathogens that are around us. So, when we're here and there's minus 30 outside, Chinese would say that's a cold pathogen out there. Just because you're protected by heating elements in this room and the walls, it doesn't mean that that energy of the cold cannot penetrate. And if you're protected by layered clothing, that it's hard and you're healthy, it's harder for that cold to do anything to you. But if you would strip and just maybe not even